Mic's live? Live stream's live? Thanks for your patience, everyone, particularly those online. We had some media here interviewing some of our guests. Welcome to the Tobacco Wars Community Summit, hosted by David Limbrick at the Victorian Parliament today. The reason that I'm here isn't just because I work for David, I'll declare that first. It's because in 2016, I founded a small charity called Students for Sensible Drug Policy. And the reason that we founded that organisation was to ensure that young people had a voice in policy decisions that impacted them. And I've hosted several panels over that time related to tobacco and e-cigarette use, and got involved in consumer advocacy in that space as well. In 2018, I attended the Global Forum on Nicotine, which is the largest international conference talking about nicotine policy issues. Now, the tobacco wars is an issue that anyone who's paying mild attention to the media in Victoria and Australia would be aware of. I had initially intended to start this presentation with a video of all the dramatic, fire bombings and arsons that we've seen, which there's been over 200 of now in Australia, over 130 in Victoria, and 4 murders in Victoria, including one of an innocent person. But instead, I want to talk about something that demonstrates for me some of the absurdity of where we've ended up with our policies. So this is a cannabis vape. A few years ago, just 8 short years ago, the part that's in the top was illegal. It contains THC. This was prescribed to me by a doctor, delivered to my door by a pharmaceutical company. But the absurdity is that the battery unit at the bottom that powers this device is illegal. It's very hard to imagine how that was done deliberately. What I think that demonstrates is that in this policy space, we've got a lot of strangeness. We've got poorly thought out policies that are not only not working as they're intended, but are causing significant harms and negative consequences. So today we're going to delve into some stories about how we got here. We're going to talk about the impacts of these policies on people like me who have used e-cigarettes to quit tobacco, on the broader community, including the retail sector that once existed to provide legal vapes to Australians and Victorians, and we're going to talk with people who consume vapes and work with people who consume vapes on how this has impacted them. But besides the absurdity, there's also some more significant things to consider in this policy space. Recent years, we've seen globally and here in Victoria in particular, a very dramatic response to a respiratory virus, COVID-19. To date, globally, COVID-19 has caused about 7 million deaths, which is a significant figure. But if we compare that to smoking-related harms, they cause about 8 million deaths per year. So for COVID, which in its cumulative impact up until July 2023 caused 7 million deaths, we turned the world upside down. And for tobacco, which kills 8 million per year, 20,000 in Australia, about 3,500 in Victoria, we have struggled to even consider embracing something like e-cigarettes as a tool that may significantly reduce the harm of nicotine use. So that maybe sets the scene a little bit for us. I'm going to invite David Limbrick up to the stage now to formally welcome you and open proceedings. David Limbrick is the member for South East Metro in the Victorian Legislative Council and representative of the Libertarian Party. For Libertarians, the issue of vaping is probably quite an easy one, as the political philosophy is really embedded in personal freedom. So the question about whether adults should be able to use vapes isn't particularly a complicated one. But I'm going to invite David up here to talk about how he's seen the policy discussions around tobacco, nicotine and vaping policy develop and change in his time in Parliament. Welcome to the stage, David.
Thank you, Ash, and thank you to the people here in person and also everyone who's tuned in at home on the live stream. Before I got elected to Parliament, vaping was in this sort of weird grey market sort of space where you had vape shops which existed legally. They could sell the machines, the tools to vape, but they couldn't sell the liquids which contained nicotine in them. And that sort of worked for people that wanted to give up cigarettes and try vaping as an alternative. They would go into their shop, they would buy a device, they would usually consult with the owner of the shop, who many of them became experts in helping people navigate this new technology. And they would often import the juice or the liquid which contained the nicotine from New Zealand or other countries, but primarily New Zealand, as they have a more sensible policy. But since then, I've seen change after change, both at a state and a federal level, where it's made it now to the point where it's not possible to legally own a vape shop. You can't do that anymore. The Victorian government, in its recent reforms, basically just washed its hands of the vaping policing and enforcement entirely and has handed it over to the federal government. And we've also seen what we predicted back in 2020, an explosion in organised crime. And the root cause of this is really there is a massive difference between the cost that organised crime can sell tobacco for and the cost that legal tobacco is sold for, and primarily that's due to excise tax that's been ramped up and up and up and up by the federal government. The other thing that's caused the involvement of organised crime, which is more recent, is of course the effective outlawing of the vaping market. This has effectively handed over a legal market to organised crime. It's just as easy, it's easier than ever actually to buy a vape. You can buy them pretty much anywhere. But the ones they're selling now are sold by people who don't necessarily know about the products, don't necessarily consult with people about the products. The products themselves are sometimes dubious. They're nearly all disposable units imported from China. They don't even say, many of them that I've seen, they don't even say the amount of nicotine in the product on the side. So you really have no real good idea of what you're actually consuming. And another thing that not many people are talking about, but I think we do need to talk about, is that we have this industry now, this black market industry, where effectively organised crime is regulating the market, not the state or the federal governments, even though they like to pretend that they are. But there's a lot of associated activity with that. And of course, we've seen the dramatic things which everyone sees, which is the arson attacks and the murders which have been happening. You know, there's been 4 murders now attributed to the tobacco wars. And as Ash said, hundreds of arson attacks all throughout the nation, the majority in Victoria. But where is all this money going? Like, this money has to be laundered. There's a whole raft of associated potential corruption happening, and lots of things, you know, lots of people must get threatened and things said to them that you never hear about because you just don't know about it because they don't want to talk. There's a lot of activity going on that really worries me, and the idea of this getting bigger and bigger and bigger should concern every Victorian, and that's why we want to talk about some different solutions and some different angles to this, because the path that both the federal and the state governments are going down, I believe, is disastrous. It won't make things better, it will make them worse. It won't help people trying to give up cigarettes. I believe it'll make it worse. It will put more money into the hands of organised crime, result in more violence, more arson attacks, and this is what we don't want in Victoria. So thank you to everyone who's agreed to come today, and I'm really looking forward to hearing from everyone who's speaking. So thank you very much.
Thanks, David. I'm really excited to introduce our next speaker. Dr. James Martin, criminologist from Deakin University, has been a frequent commenter in the media over the last couple of years and delivered a presentation at the recent Victorian Alcohol and Drug Association conference that really delved into the incentives that have been created by the policies at a federal and state level, and how, as well-intentioned as some of them might be, and as well-intentioned as some of the enforcement efforts might be, they actually continue to create more incentives for crime and for things, as David said, to potentially get worse. So it's my pleasure to invite Dr. James Martin to the stage now.
Thanks, Ash. Thanks, David, and thanks to everyone for joining us both in person and online. So as Ash mentioned, my name's Dr. James Martin. I'm a criminologist from Deakin University. My expertise is in illicit drug markets, or has historically been in illicit drug markets, and I never really thought that I would be commenting on tobacco and vapes. It was inconceivable just a few short years ago that we would see the kinds of criminal activity and the massive expansion in the illicit market that we're seeing around those two products. This was entirely predictable. 6 years ago was the first time that I predicted, as a result of the tax increases, that we were going to get an organised crime problem surrounding tobacco. Never anticipated that a harm reduction product like vapes would be subject to the kind of over-regulation that we're seeing here. So anyway, my short talk with you today is just to give you some insights into around some of the organised crime issues, some of the incentives that exist around the nicotine space, and also to draw this to what we know about the war on drugs, because increasingly we're seeing a war on drugs style approach when it comes to nicotine. And we're being told by our federal politicians that this problem is solvable through increased enforcement. From a criminological perspective, there's no evidence to support that claim. And I'm going to give you some of the countervailing evidence that suggests that this approach is not a sensible one. Alrighty, so what we're seeing in this country, despite the fact it hasn't been spoken of this way, is an emerging war on nicotine. And when I say war on nicotine, consistent with the war on drugs approach, what we see is an overemphasis on supply reduction. So our national drug strategy is built on 3 pillars: demand reduction, so that's doing things like education campaigns, rehabilitation services. We've got harm reduction, which in the illicit drug space is things like pill testing, overdose prevention centres, but in the vaping space, well, in the nicotine space, we actually have a market to harm reduction solution, which is vaping. And what we're seeing, and the other one is supply reduction. Now, despite the fact that in theory they're supposed to be relatively equal pillars, we're seeing overwhelmingly funding go to supply reduction. And by supply reduction, what we're talking about is law enforcement. So that's everything from transnational multilateral policing operations involving the AFP and partner agencies overseas, scanning at the border through our border force agencies, and of course the really big one is state policing. So what we're seeing here in terms of the vaping space is exactly the same. So we've had funding, over $300 million in funding has now been allocated to illicit nicotine products. So both tobacco and vapes being the really big one, although it is including some newer products as well, things like nicotine pouches. So the overwhelming funding goes there. We do see much smaller allocations going to demand reduction in the form of these kind of education campaigns things that we see here: say no to vapes, there's bug killer in your vapes, you know, formaldehyde, all these kinds of often very over-exaggerated claims. Our ban on less harmful nicotine products, and it's really been driven by, I think, some very spurious claims, particularly around the supposed impact of vaping on young people. So we're told that there's a vaping crisis amongst our youth, and this really isn't consistent with the data that we see. Over 70% of teens, this is according to the gold standard research that we have here, the National Drug Strategy Household Survey, over 70% of teens have never tried a vape, and just 3.5% vape daily, which, you know, that's not great. We don't want teens engaging in regular vaping use, but we need to keep these numbers in perspective. That's fewer than the proportion that was smoking daily a decade ago. So we haven't really credited the rise of vaping amongst the small proportion of teens who are doing it with nearly eliminating teen smoking, which is, you know, the real harm reduction potential. The other thing that you'll hear is that vapes cause teens to smoke, the so-called gateway effect. So the New South Wales Cancer Council released a study last year saying that teens who vape are 5 times more likely to smoke. There's some really, you know, misleading interpretations of that. It implies causation, whereas in fact the most likely explanation is what we call common liability. That is that a teen that is more likely to try one type of risky behaviour is also the same kind of teen who's more likely to engage in other types of risky behaviour. The best evidence that we have for this is large-scale population surveys. And what these large-scale population surveys tell us is that far from being a gateway to smoking, vaping is actually a gateway out of smoking. We see the fastest reductions in rates of smoking amongst age cohorts that have taken up vaping in the largest numbers. That's not just in Australia, that's in any jurisdiction around the world in which vaping has been taken up in large numbers. So, other countries, and we'll be talking about some different approaches, have embraced this, have embraced vaping and other forms of less harmful nicotine products as key tools in the fight against smoking. Whereas here we've taken, alternatively, this war on nicotine style approach. Now, there's a few things to note about this. So we'll be talking a little bit today about tax. I'm not going to bore you to death with numbers, but there's some important figures that we need to keep in mind here. So this yellow line here is the daily smoking prevalence amongst adults in Australia. And you can see that it's on the decline. Despite what we're being told by our tobacco control sector, we are not world leaders in this space though, right? Despite the progress here, this is not as fast or as significant a reduction as we're seeing in many other countries, particularly those that have embraced tobacco harm reduction. So we've got, but it is trending in the right direction, but there's some really important nuances in this graph. So we've got our smoking prevalence declining here, and the blue line, this is the level of tax that has been imposed on tobacco products. So you can see very, very steep increases, commencing here with this 25% increase in the tax in 2010. Now, the significant thing that I want you to take out of this is the rate of smoking decline in the pre-tax period, where we saw very small increases associated with increases in CPI, so inflation. There was very small increases in tobacco tax. The rate of smoking decline is statistically no different in the 10 years preceding these tax increases as the 9 years following it. So in a time that the price of legal cigarettes is the important qualifier there, at the time the price of cigarettes more than doubled, we saw no statistically significant difference in the rate of decline as the pre-tax period. So if tax was the most important thing in the fight against smoking, we would have seen an accelerated rate in the decline of smoking, but we didn't see that. The key difference, though, is what happened in 2019 to 2022-23. This is when we actually saw a very, very significant decline in smoking. In fact, the biggest decline in smoking in the previous 30 years. Few interesting things to take out of it. It was a period of relatively no tax increase. Actually, the real price of cigarettes slightly fell across that period. But the big difference was we saw an increase in illicit vaping. So the big decline in smoking that we saw in that 2019 to 2022-23 is likely not due to tax increases, but to the rise of vaping, which in Australia is almost all illicit. Okay, now some other graphs that I'm going to show you here. So we're seeing increased tobacco seizures and a major marked exponential increase from around 2018 to 2019. We know the border force, when it comes to other illicit drugs, doesn't detect the vast majority of illicit drugs that are coming into the country, and I'm going to show you some other graphs to demonstrate that there. So despite these very significant increases, this is a small proportion of the overall amount of illicit tobacco that's coming into the country. If it's consistent with other illicit drugs, we're only intercepting 20 to 25% of the illicit tobacco that's coming into the country. So, the amount that's successfully making it through is going up and up and up. In other words, these increased seizures are not a sign of success. They're a sign that things are going wrong. The analogy I typically like to use is it's like a bunch of, when you see police and law enforcement agencies celebrating this record high seizure of illicit drugs or tobacco, it's like a bunch of doctors sitting around celebrating that their patient's temperature has hit a record high, right? This is not a sign that things are working. It's a sign that things are going wrong. Now, accompanying this, so these are just arson attacks that have been reported in the media. We know that there have been other arson attacks, and of course, as David mentioned, countless instances of what we call the dark figure of crime. These are crimes that go unreported to police. So we only find out about these arson attacks and other instances of extortion when people report them. God knows how many of these instances of violence, co-opting otherwise law-abiding citizens into the black market that we know about. You can see these have been steadily increasing as well. We have seen a bit of a hiatus in recent weeks. It's been interesting to see that. We don't have good explanation why, but what this really reflects is the increasing amount of money that is in the illicit tobacco industry, which we don't have precise figures on this again, but it would be ranged in the billions of dollars. We've seen estimates between $2 and $5 billion in terms of annual turnover. All right. So what does this actually mean? Well, in terms of counting the costs, there are very significant costs associated with this. So when we're just looking at vapes just by themselves, again, the National Drug Strategy Household Survey is useful here, shows that over 96% of people who vape in Australia now source their products illegally, right? So from the black market. There's around 1.5 million people who vape in Australia. 96% of those are getting it from the illicit market. That means that vapes alone, not counting illicit tobacco users, but vapes alone constitute the second largest illegal drug market in the country, just after cannabis. So, absolutely massive. And when you hear people, particularly some tobacco control experts who say, enforcement is the way out of this, a child could enforce this market, they really don't know what they're talking about. This is a massive organised crime problem and not an easy one for law enforcement to solve. At the same time, we've seen an absolute collapse in tobacco excise. So in the last financial year, the legal tobacco industry reported a decline in sales of cigarettes of around 30%. That's similar to the rate of decline that we're seeing in tobacco tax excise, which dropped from an estimated $15 billion to just under $10 billion. So, what we're seeing now is this massive collapse, $5 billion black hole in the budget. That's more than Australia's entire drug law enforcement budget, just for context. So we've seen a massive expansion of organised crime and associated violence, increased burden, of course, on our law enforcement agencies. Policing agencies have been pretty open about this in the various inquiries and comments to media. This is not a problem that they want to be lumped with. This is very much, I think, an issue of unrealistic public health policies, creating problems that other parts of government, particularly law enforcement, have been forced to solve. As David mentioned, also we get this proliferation of more dangerous illicit substitutes. So if you go to a legal vaping market, like they have across the ditch in New Zealand, you have consumer protections, limits on nicotine, all those kinds of sensible things that you see with other kinds of legal products. Here we don't have that. So as a result, the illicit vapes that are out there that predominantly do come from China have much, much higher levels of nicotine than we're seeing in the kinds of markets where vapes are legal and readily available. Okay, so will this war on drug strategy work? The increasing hundreds of millions that we're seeing funneled into illicit nicotine regulation. And just to put this in a bit of context, so the slides I'm going to show you now are basically going to be showing the relative ineffectiveness of this approach with other illicit drugs. So between 2009, 2010 and 2020-21, we saw a threefold increase in Australia's illicit drug enforcement budget. So that is now around $3.5 billion we spend each and every year on supply reduction. So everything from the border to state policing and so on. This doesn't include the $330 million that has been allocated to illicit nicotine products just in the last couple of years. Now, what do we get for that money? Well, the police aren't doing nothing. In fact, law enforcement are doing quite a lot with this money. When we break down, so this is a breakdown we can see here of various drug seizures, both at the border and domestically. So the light green here, these are domestic seizures of cannabis. The dark green are seizures at the border. You can see a very, very clear trend here. We are seizing more illicit drugs than we ever have before. What this is supposed to do is send a message to drug traffickers and drug dealers that this is not a safe trade to engage in, and this is supposed to translate into higher prices for consumers because these are products that need to be replaced. Coinciding with this, we've seen a massive increase in the number of drug-related arrests here in Australia. So we've got our consumer arrests, so these are personal possession drug charges, and our provider arrests as well. Very clear trend upwards. We do see a decline in 2020-21. This is almost certainly due to COVID. So you take that COVID bump out. If we had more up-to-date statistics, which we don't yet from the Criminal Intelligence Commission, we're likely to see this increasing. Again, what this is supposed to translate to is increased price for consumers. And the reason for this, so the theory goes, is that as you increase enforcement intensity in any drug market, this will translate to more risk for drug dealers, and drug dealers will respond to that by charging a premium for their services, by saying, right, I'm not going to sell drugs in this illicit market unless I can charge more money because it's more dangerous, more chance I'll go to prison. Now, what do we actually see? Well, this is research from the National Drug and Alcohol Research Centre at UNSW. They have these sentinel groups, so they ask people how easy it is to get illicit drugs. And you can see from 2007 to 2024, basically no change in the perceived availability of illicit drugs of various kinds. Again, notwithstanding this bump here, the COVID bump, which did significantly disrupt illicit drug supply, not just in Australia, but around the world. Of course, that wasn't a result of any law enforcement action. That was disruption to global supply chains that, we all remember the queues around toilet paper and all the rest of it. So, the same things happened in the illicit drug market. So it's no harder to get illicit drugs now than it was at any other point in Australia's history. Now, what about prices? Well, this is where it starts to get pretty weird. If you take most illicit drugs, certainly the big ones that we have here, the most popular illicit drugs, we don't see any substantial difference in price. In fact, prices are either stable or slowly trending downwards. A gram of cannabis costs $20 now, it cost $20 when I was in high school. So no real effect on illicit drugs prices. And for some drugs like methamphetamine, obviously of considerable concern to the community, we see prices declining. But I want you to think back to when you were in high school. Are there any other products that are the same price now as they were then? Think about a cup of coffee or a pint of beer or whatever you like. When we adjust for inflation, we actually see the impact of prices in real terms. And what we see is this. We see very significant decreases once adjusted for inflation, the prices of pretty much every illicit drug in Australia. So methamphetamine is around half the price it was in real terms in 2007, and we see similar varying rates to varying degrees, these kind of declines across all of our other illicit drug types. So this presents something of a paradox, right? It doesn't comply with what law enforcement agencies tell us. It doesn't even conform to what our criminological theories are around this, around risks, prices, and how that's supposed to translate into drug availability. Drug enforcement is being funded at a record high levels. They are doing stuff with that money, but this is not translating into any meaningful impact on the supply of illicit drugs in Australia. This goes the case for purity as well. So I haven't included any slides on purity here because it's quite complicated, but purity for most illicit drugs, again, is either stable or trending upwards over the longer term. All right, now why isn't this working? Deterrence, and supply reduction as it's currently conceived of, I think is failing for a fundamental reason, and that isn't actually that we can ever deter enough offenders to make a significant dent in the market. The people that persist in illicit drug supply are different, typically, or at least have a different conception of risk. So while you or me or another person, average lay person wandering around the street might see penalties going up for illicit drug distribution or nicotine, sales of illicit tobacco, cigarettes, that's not necessarily how everyone sees it, right? There will always be, and we know this from a long history of war on drugs, there's always a critical mass of people who are relatively risk tolerant and who are prepared to take the risks of increased enforcement. What these fines, penalties, this emphasis on this war on drugs approach actually does is create market opportunities for these people. If you think about that single gram of cannabis that might be $20 on the street, and you think about how much that gram of cannabis might cost once you get it across a prison wall, for example, you're going to see a significant increase in price. What that does is it creates an opportunity for arbitrage, right? That is, you've got two separate markets now, and I can use the difference in price between the street price and the inside prison price. That's what I can take in profit. So we need to stop thinking about this from the perspective of a person with normal risk kind of tolerance and think of it from the perspective of someone who's prepared to smuggle drugs. For those people, the barriers, whether it's a prison fence, a barrier at the border, increased fines and penalties, do not represent deterrence. They represent job opportunities because I rely on that prison fence being there. I rely on that border scanning facility for me to have a job. right? For me to have actually an illicit opportunity to participate in the market and to tap into those incentives. Now, this is exactly, sadly, what we're seeing with nicotine as well. As we increasingly constrict the supply of nicotine, and we know that nicotine consumption is largely stable in this country. We do wastewater analysis that shows us since it commenced in 2016-17 that nicotine consumption is exactly the same now, or relatively stable, trending upwards. Is actually at the highest ever record level in regional areas of Australia. But we know that the proportion of that nicotine consumption is increasingly being dominated by the illicit market because of these restrictions. Now, I'm not going to spend heaps of time on this. This is my last slide because we will be covering this in other sessions. But it doesn't have to be this way, right? Australia is not a world leader in this space because, as you can see here, if you compare it to some of the real world leaders here, Sweden and New Zealand, just to take two examples, this is what happens. So we've got our daily adult smoking prevalence here. So this is the same line in my previous graph. You can see that smoking in New Zealand was consistently tracking higher than it was in Australia. The big change was in 2020, they legalised vaping. And just in a few short years, we saw a massive decrease in the rates of smoking in New Zealand, particularly amongst priority populations. So First Nations, New Zealanders, lower socioeconomic groups that in Australia still smoke at stubbornly high levels. We see even better success here in Sweden, where there's been a much more liberal approach, well, the world's most liberal approach to other less harmful nicotine products. So that's been snus historically, so little pouches of tobacco that people put on their lips, and the more recent iteration of that, which is nicotine pouches, which are entirely synthetic, don't contain tobacco, so are not tobacco products, and are not associated with significant health risks. It's been the ready and easily availability of these products that have enabled countries like Sweden, countries like New Zealand, and others to reduce rates of smoking without creating the organised crime problems that we're seeing here. And of course, because there's been a legal market for these products, we haven't seen the opportunities for organised crime to come to dominate those industries as we have here in Australia. All right, I'll leave my talk there for the moment. Thanks very much for your attention, and I look forward to speaking with you further.
Thanks, James. I think that really paints the picture of how some of the incentives that have been created by our policies, rather than solving them, are actually exacerbating them. Before I invite our next speaker, bathrooms, we've got staff and attendants from Parliament down the back of the room. They'll show you where to go for that. Tea and coffee at the back of the room. And for folks online, thanks for your patience in getting started today. The reason for that was that we had some people from the media interviewing some of our guests, so we slightly delayed our start time. We are hoping to allow for plenty of questions, Q&A sessions. Because of that delay, we might not get to that in the first session, but there'll be plenty of opportunity throughout the course of the event. For folks online, leave your comments and questions in any of the threads. We will try and get to them when we can. We've got a whole range of speakers that, it may not be that we'll get to it in this session, but we can come back to it later. Now, for our next speaker, we've got Jordan Ditloff, who's the Senate candidate for the Libertarian Party, but he also has, I think that last little slide that, the second last slide that James spoke about there is relevant to Jordan's history. About a decade ago, he'd gotten into trouble with drug and alcohol issues and ended up getting into trouble with the law. So he's seen these incentives play out both personally, but within people that he associated and came across at that time. Now he's a law graduate and does work with people that are also experiencing drug and alcohol issues or have been incarcerated to also help them get their lives back on track. So he's going to share some of his experience of how those incentives that James was talking about play out in the real world and affect people that are maybe some of the more vulnerable members of our community. Welcome, Jordan.
Hello, everyone. That was a great introduction. Thank you, Ash. I had no idea exactly what James was going to speak about. I've read his work and been following him on socials, but that presentation was perfect because I'm now going to talk to you about the other side of the coin and the perspective. Hello, it's me. I am the smuggler's mindset. I am common liability. I was that child in my teens who essentially had a very different risk appetite. I was pretty good until quite a bit later than a lot of teens who get involved in drugs, but that was mainly a function of opportunity. I lived 40 kilometres from the nearest city, literally in the middle of nowhere, and essentially I just was a late bloomer when it came to adopting recreational drug use. My first job was also in the Australian Regular Army, where there was some really specific deterrents from getting involved in recreational drugs. But when I finished up in the Army at age 20, I started working in hospitality and nightclubs, and very quickly thereafter started using, and before too long, trafficking ecstasy. So what followed through the course of my 20s was fairly extensive brushes with the criminal justice system, escalating patterns of use with, at first recreational, then far less recreational drugs, culminating in trafficking of cocaine, ketamine, methamphetamine, and ecstasy. And on the 7th of July 2015, I was arrested in an undercover police sting while on bail for other offences relating to my failed business. And ultimately, that marked the beginning of a 27-month term of imprisonment. Now, something else happened at that time, which at the time, obviously, I had a lot of other things going on in my life, and I was much less cognizant of the importance of this, but it's very relevant to the topic we're talking about today. And that is, in 2015, in late to mid-June, Corrections Victoria banned smoking in prisons, in Australian prisons. And what played out and followed over the next couple of years in Australian mainstream prisons was almost like a precursor or a mini version of what we're seeing play out on our streets today. And so I sort of knew what was coming, both because of my own experiences in contraband and drug trafficking, but also because of what I saw in the prison environment when the prison wall James was kind of metaphorically and literally referring to in terms of internal prison contraband and smuggling, also incorporated tobacco at a time when tobacco was still completely legal and, in 2015, relatively lower taxed. So while I was sitting in police custody waiting to be remanded and assigned a remand prison, I was in police cells in custody watching on television as prisoners at the Melbourne Remand Centre, the MRC, rioted and burnt down 70% of the remand beds in Victoria, which at the time, this was 2 days after my arrest, everyone in the cells, the police custody cells I was at, was cheering, watching on the TV as prisoners commandeered a little bulldozer and ran over a part of the fence and unlocked the medical bay in the prison and all sorts of shenanigans. What they didn't realise at the time as they were cheering was that that would mean another 3 weeks in police custody as Corrections Victoria scrambled to fill the remaining remand beds. So by the end of week 3, the guys I was doing police custody with weren't so cheerful and didn't find it quite as funny. But what followed over the next couple of years was exactly what James talked about in his presentation and what the modelling would predict. You had no impact, virtually uninterrupted supply of nicotine in the form of tobacco pouches. The only small delay was while the smuggling routes and contraband sort of bypassing got figured out, there was a period where prisoners would actually be boiling nicotine patches to remove the nicotine from the nicotine patches, which were being given to them for free in a mandatory fashion to help them ease off smoking. And they would boil the nicotine patches and then put that into basically custom-made rollies and continue to consume nicotine. I think that it would be fair to say most people who are in prison would be the Elon Musks and entrepreneurs and small business owners of the real world if they applied their talents in slightly different directions and had slightly different priorities. And I have seen prisoners who might not even be literate remove PowerPoint sockets from walls and live earth wires across laundry detergent to light illicit cigarettes in prison. It is like Breaking Bad, something like things you've never seen before. But the effect was that supply remained unchanged, violence and standover behaviour increased, and prices increased. And there was another important thing that happened, which James's model and presentation didn't talk about, and perhaps understandably, because if I was in James's position, I would be reluctant to discuss corruption without firm evidence. That's James's line of work. But I can tell you that as soon as the incentive to supply a legal product for which there was no penalty to carry in the real world into prison, where it was contraband and worth as much as 10 times the street value in the real world, Corrections Victoria staff and prison officers absolutely became involved in trafficking cigarettes and tobacco into prisons. So to think that in the world we're seeing play out in this situation of incredibly high excise and a burgeoning black market in Victoria, but also in New South Wales, we would be naive to think that there is not a significant effect on law enforcement, both at the border force level and at the state and AFP level. I haven't been made aware of any specific instances of corruption, but if you look at the 1920s, during the period of the Volstead Act, you saw prohibition agents standing in front of large seizures of alcohol, but then we later found out that those same prohibition agents were often responsible for bootlegging, smuggling, and taking bribes to look the other way. So we would be absolutely foolish and naive to think that for every seizure at the border, there are not 5 more that are either assisted through or go through unchecked. Another interesting historical event that I wanted to touch on, because I was listening to James talk about, and David as well, talk about the 4 deaths that have happened through this period of time in what we've kind of come to call the tobacco wars. And that was another period of intense gangland rivalry around the ecstasy trade in the early 2000s that later became known as the Underbelly Gangland War in Melbourne. So in June 2003, Jason Moran, at age 35, was executed brutally at an Auskick footy game in front of his children and in front of a horrified Auskick team and families. And we would be more than foolish to think that that is not the inevitable consequence of no change in policy if we don't make dramatic changes to the policy settings we've got at a federal and state level. I'm not in the business of predicting much with certainty, but I can predict with certainty that a scene like that will play out in the next 5 to 6 years if we do not make changes now. And that will be the point at which everyone else will be scrambling to find solutions to the problems we're discussing today. And people will look back on this and say, wow, we really should have done something now. So I just wanted to make that point. I am here with 2 hats, and I'll talk about politics later in another panel, but from a personal lived experience point of view, James is spot on. There is a cohort of people, many of whom I've met, who view the current policy settings as an opportunity. This is particularly true with illicit tobacco, where the consequences for street-level dealers, if you will, that is tobacconists and people selling black market vapes and black market tobacco, is almost zero. The reality of law enforcement at a state level on the street here in Victoria, as recent investigations by myself, along with Rob Berry of Leaf House Vape Shop, and anecdotal evidence from the street level, is that it is easier to obtain illicit tobacco and vapes in Victoria than ever before. The police in Victoria have quite rightly said that it is a federal problem being caused by federal policy, and they are now de facto running dead on enforcement at the street level. So as federal interdiction and AFP border force operations intensify, on the streets, on the ground, where it matters most, law enforcement is missing in action. And I don't blame them. It's a waste of their time, it's a waste of their resources, and it's like playing whack-a-mole. It's a game you can't win. And ultimately, the consequences of that for a society are significant. Trust in police, morale of police is hugely impacted. Police feel incredibly frustrated and frankly powerless, which they ultimately are. And as David said before, it's never been more true than to say that organised crime is responsible for regulation of tobacco and vaping in Victoria. And increasingly New South Wales, as a less mature market reaches fruition and competition begins to intensify. So this is an economic problem. We don't have a law enforcement problem. We don't have a drug use or nicotine use problem. We have a policy and markets-based problem. And until we start seeing solutions that use that language and that framework, we are not going to see change. So from the point of view of someone who has been involved in contraband and in illicit markets, I just think that this is an opportunity we have now to act and avoid almost certain dire consequences in the near future. So I've got lots more thoughts on how we can do that, but I'll leave that for a later conversation in a future panel. Thank you very much.
Thanks, Jordan. Now we were hoping to do some Q&A for this session, but because we were a little bit delayed, we will leave that off. We'll take a very short break for anyone in the room that needs to duck to the bathroom. For people who are online, you've probably got enough time to boil the kettle and settle in for our next session, and we'll be back in about 5 minutes. Check, check. We'll start moving things along again, folks. So if you want to just wrap up your conversations there, come back to your seats. We will start the next session shortly. Okay, let's kick things off for the next session. As I said in the introduction to the event, one of the reasons that I'm here and hosting it and my previous involvement has really been around elevating the voices of people impacted by policy decisions around drug and alcohol. In the nicotine space, I'm also one of those people. So I might start just with a little bit of a story about my own involvement with e-cigarettes and vaping, both in a personal and an advocacy capacity. So I first started seeing e-cigarettes pop up around the festival scene, particularly amongst my circus performer mates, interestingly enough. And this was around 2014, 2015. And the devices back then, far from what you might have heard from some people in the media, were not designed by big tobacco. There was no sneaky ploy to try and get a new generation addicted to nicotine. They were really rudimentary devices. They were essentially a battery, a heating coil, and some juices that vaporize nicotine with some flavors. And the people at the time, they would jerry-rig these devices. Like, a lot of them were really new on the market. They'd sit there and make their own coils at home. They would like change them and get really nerdy about it. Now, I wasn't sure if these things were safe myself when I first started seeing them. So I asked lots of questions, I read lots of science, I double-checked, I spoke to doctors and experts that I knew, and eventually I was convinced that they're probably a much safer option than tobacco and something that I might like to try for myself. And I eventually did. And once again, far from this big conspiracy of big tobacco, the first vape juice I bought was from a dude's garage up in Preston, where he was home making the stuff. And this is what existed, because there wasn't a legal market for nicotine-containing juice in Australia. There never has been up until this point. So there were a lot of vape enthusiasts that managed to spin off a side hustle, selling juice to their friends. And then I started bringing in the nicotine and all the ingredients, and me and my old housemate, we started making the juice ourselves at home. And I tried several different devices, and they were okay, but eventually I'd be like, oh, I don't like this one. It's causing irritation in my lungs, or it's doing this, or it's doing that. But I knew I'd started to narrow down on what I wanted, what worked for me to satiate my dependency on nicotine, give me an enjoyable experience, and ensure that I didn't go back to smoking cigarettes. And so I asked the advice of one of the vape store owners. Here in Victoria, we did have what we call the legacy vape stores that were actually regulated and licensed by the government to operate as vape stores. And these people that started these stores, primarily, there were those guys that were doing the garage jerry-rigging of devices. They were the early adopters who were so enthusiastic about these devices that they just wanted to get all of their mates, all of their friends, all the people that were smoking onto vaping so that they could eliminate or reduce their risk of lung cancer, of heart disease, of all of these kinds of things, because they'd felt it themselves. They'd felt better, their health had been improved, people that they'd given the devices to were giving them the same feedback, and then they turned that into a business. And so I asked one of these vape store owners to recommend a device for me based on what I described as my preferences. And when he did that, that was the same device I used for about 2 years, right up until October last year, when the latest vape bans came into effect. And Finn, could you play that video for me now, please? So this is a collection of every illicit vape that I've bought since October last year. I kind of didn't know what to do with them. So I've just been collecting them in a box. And I've lined them all up yesterday and filmed them just to give a bit of a demonstration of what that looks like. So previously in a week, I would use, just go back to the other slide now, please, Finn. So previously in a week, I would go through a little coil for my vape device. I'd go through maybe half a bottle or a bottle of juice, which I had imported legally from New Zealand under prescription in a market where it was regulated. I knew what was in it, I knew what the nicotine strength was, and I knew that the New Zealand government had prohibited the most harmful compounds so that the risk was much lower than what I might get in an unpredictable or an illicit market. So that's been the impact on me. It's cost me about 3 times as much per week. I'm generating all this e-waste that I don't know what to do with. I suppose at some point I'm going to have to throw them in one of those bins at Officeworks to try and get them recycled, because lithium-ion batteries tend to be quite a hazard for landfill and firefighters. And I have less certainty about the safety of the products that I'm using. But the other thing that's happened, which I'm really, really sad about, and our next speaker, Pippa, will probably talk more about this, one of the things that I'm really sad about is that the narrative that's emerged from some of the public health, the anti-tobacco, the anti-vaping organisations and figures in the community have started to convince people that people like myself had managed to convince to switch away from smoking to vaping as a less harmful alternative. They've muddied the water on that. They've convinced them that vaping is more harmful or as harmful as tobacco, and they've switched back. And the fact that the only easy way to get nicotine products now is this complicated prescription pathway to get products that most people don't like in pharmacies that mostly don't provide them, or the illicit vapes. And now that the ubiquity of the illicit market in tobacco has just saturated and become so available, it's probably cheaper to smoke now than it is to vape, which is pretty wild. I mean, even as somebody who was a pretty enthusiastic vapor, I'd at most spend $25 to $30 a week. Absolute most I'd spend, if I cut back, at probably half that. But now, for people, now I'm spending about probably $80 to $100 a week. And the price of cigarettes, if I switched back to tobacco and just smoked, like 10 cigarettes a day, it would probably be cheaper, which is a crazy incentive or outcome that has been developed from public policy. But enough from me. Pippa Starr has been around doing advocacy probably a little bit longer than me, and those figures that you might have heard in the media about how many arson attacks there'd been, Pippa was one of the people that actually compiled that list, went through all of the media reporting, put it up on their website, and helped clarify exactly how many arson attacks had happened. They've also created an organisation called Alive, the Alive Advocacy Movement, to bring together other vapors who want to ensure that their stories are told accurately and ensure that lies told by public health and politicians get called out. So we're gonna see if our tech solutions have worked here, and I'll get Pippa on the stage and just check that everything's.
All right, check 1, 2. All right, I'm up. Hello and welcome all to the Tobacco Summit. Firstly, thank you to the Libertarians for holding this. Am I ever coming too soon?
No, I can hear her audio on my laptop here, but it's not coming through the feed yet. So
Okay.
just stand by, Pippa.
Thank you.
We've just got our tech guys figuring out what's happened here. We're trying a bit of a complicated thing, as often happens now, a bit of a hybrid meeting where we're bringing a couple of our guests in online and some in person. So for everyone. Could you say something again, Pippa?
Yeah, check 1, 2. Hello. Australia, let's improve vaping education.
What I can do, I could bring up Rob while we try and figure out what's happening there and come back to
Okay.
Pippa.
No problem, no problem.
My friend Rob's going to tell me off now for not getting Pippa in before we started the event to do a clear tech run. Rob, how about we bring up Rob Berry and we'll try and come back to Pippa while we troubleshoot what's going on. Okay, so we'll just put you on hold for a moment, Pippa. We'll get Rob and the AV team here at Parliament to keep working with you to figure out how to get everything working. So we'll switch the order a little bit. Our next speaker is, well, first of all, one of the things that I want to say before I introduce our next speaker is that that anecdote that I told about getting really expert professional advice from a vape store owner, that particular vape store owner had built up, I think 4 or 5 businesses that were operating here in Melbourne. And like I said, they weren't selling nicotine, certainly not to any children, nor to anyone else. They were providing vape devices, expert advice on successful quitting methods, how to get them to work for you to help you quit, and some of the flavoured juices that people could add their own nicotine to. But what happened to that particular store owner is that they were targeted by the TGA, the Therapeutic Goods Administration, for a really innocuous message that appeared on a website in New Zealand and kind of hounded and eventually fined and had their entire business destroyed. Ironically, one of the stores that was employing people here in Australia, giving them nice jobs, helping people quit smoking, once that was shut down by the new bans brought in by the Albanese Labor government, what replaced it, or either replaced it or popped up next door, was a store selling illicit vapes. So rather than, destroying any vape sector, the primary outcome has been that it's been shifted from a legal expert advice sector to one that provides completely unregulated devices, possibly facilitated by organised crime and readily available to children and teenagers. So our next speaker is one of those store owners who's going to talk about what happened, what they did prior to October 2024, and what the impact has been like for them, their business, their employees. Rob Berry from Leaf House.
Thank you. I know that shop owner he's talking about. I wish he was here. There's a lot of great shop owners that have been in this industry. Paul's here, that are off doing other things. They're not with us, but they've got a lot to say. I brought some, and I remember that period of time. That was a great period of time. I wish I could go back. Our first shop we opened in 2012. It didn't last long, 2012 or 2013. We ended up closing it and opening another one in 2015. But most people would come into the shop and just ask us, what is vaping? That's what it was like. We had dreams. We were watching the American market and we loved vaping so much. And we opened a shop a little bit too early. But I bought some devices. I guess everyone here knows what these things are. I've bought a mod, which is basically a battery-powered device. There's no nicotine with this. It's a regulated voltage output thing. They're banned. and an atomizer that goes on top of it. And there are many hundreds of these things of different qualities and different designs, and it gets quite techy and interesting. I brought a cannabis vape. These are banned as well, and these are being pushed into the pharmaceutical world, and pharmacists aren't experts in selling these devices. So they may know a little bit about cannabis, but they shouldn't be selling these devices. These devices should be sold by the free market and the willing, people that are interested in these devices, that know about these devices. They should be sold by experts, not by sort of healthcare workers or people like that. I brought a device to replace your one. I saw the one on the video. It's really old, so I got you a new battery for your cart. It's a cool one. So juice, with this juice, so we sold juice that didn't have nicotine in it. This is a British juice which is made to the British standards. We imported this, and we can qualify it has a high standard under the British system. This is a US juice, which is made to the US standards, and that's a nice high standard as well. And then we've got an Australian juice, which is, to their credit, Oceana Labs have made this in a ISO 7 certified lab, and they didn't need to. They didn't need to make it in a lab. They could have mixed this in the sink at the back of the warehouse and sold it, no problem. But they made it to standards by themselves with their own decision making. So that's, when you've got a market where you've got people that are inspired by the product, that want to sell the product, they will bring it to the market to the best standards, even though they didn't have to. They set up a lab, hundreds of thousands of dollars to set up a lab. They literally could have mixed this in a kitchen and sold it, no problem, And they were operating basically with the idea that sooner or later, e-liquid would be legal, and they would be in the perfect position to comply to any standards. And as were most of us, were in that situation as well. We were thinking that way. So I'm just going to go through a timeline of events, basically, with most of it's been talked about just before, with that first initial group of people that were tech enthusiasts and that were inspired to sell the products. That wasn't enough, so you had a ban on nicotine. So the people wanted to enter the market, but they looked at the situation with nicotine, and that was a deterrent. So you would have had a few like me and Paul and a handful of others from back in the day. We got in early and we were inspired by the technology and took a risk, and we eventually built up our businesses. But then there was new entrants that would sort of get halfway into the process and then bail out. Good people with integrity that wanted to bring vapes to the market in a very well-presented way. But with this nicotine, they were didn't want to get their hands dirty, and it's too complicated. And why would you want to get involved in the industry when you've got this big barrier with the nicotine? Most people vape with nicotine. That's just the way that it is. So over the years, we tried our best to get the nicotine to the customer as quickly as with as less resistance as possible, and that became harder and harder over time with the emergence of disposables. Back in the day, people were a little bit more willing to hear your pitch out. So you'd explain, you would need to get a script from, and we we can tell you what particular doctors you could go and see potentially, and then you've got to import your nicotine from New Zealand, and people were more receptive to this way back in the day, but eventually they just wouldn't, they had no patience for it. But over the years, we tried to streamline it. We were able to offer people a questionnaire, and we could quickly punch out their response, and then we would, get that to the doctor that would give them a script, and then all in the one transaction, we could get them pretty much get them a script and their nicotine on the way. And we were able to do that, but that wasn't enough eventually. Eventually, people would just, if you didn't have nicotine, they're out. And it wouldn't matter how good your products were, they would go out straight away. And obviously, nicotine disposables are everywhere. So, why would they sit there and listen to us for 15 minutes when they can just get their nicotine straight away? Basically, we had a round of legislation back in the day on the state level. Then in 2017, us in Victoria, we all got a licence. They never policed, we followed that licence to the T. They never came and checked us, not even once. And we were willing to, most people, if you tell them the rules, they're willing to comply. I've seen it in America with their cannabis. They're selling cannabis and they're selling it to the rules. They're very happy that they can sell it. And, you don't see a lot of black markets and things, because the rules are there and you can follow them. As long as you can follow the rules, you get people follow. As long as there's rules that can be followed, you get people willing to follow them. And then in 2020, we had Greg Hunt did a round of reforms or proposed reforms that eventually didn't end up going through. But that period in time created a environment of scarcity with vapes, and there was a humongous investment in disposables at around 2020 because it was all about vapes. Vapes were highly controversial. I had barely seen that many disposables around until after that 2020 round of proposed reforms by Greg Hunt. And then we saw at that time the tobacco guys were dipping their toe into the vapes, but mostly we saw smaller business entrepreneurs investing in vapes along with their other businesses of importing other things. Good people that were just importing them because they were easy to sell. And then we saw shopkeepers importing them directly and tobacconists and corner shops importing them directly. And then we saw a bunch of younger entrepreneurs importing them and selling them, sort of bootlegging them here, there and everywhere. And then, so they were the people that were distributing them prior to all of this. And then in 2023, when the announcement was made for this current round of reforms, that's when we saw the tobacco guys and the Chinese guys really step up their game in the Australian market. We saw hundreds of Chinese reps on the ground here in Australia, and all due respect to the participants in this marketplace as well. I don't want to throw anyone under the bus. I think it's just a natural response to what's been going on. Hundreds of reps, so between 2023 and 2024, so from the announcement to the laws coming into effect, we saw the black market step up their distribution game, and we saw loads of Chinese reps flying over and going door to door, door knocking, building relationships and rapport. And we saw the smaller importers sort of stepping away. Furniture companies or other companies that were importing the odd container of vapes here and there weren't doing it anymore after then. And then after the laws passed, then virtually, so the black market distribution consolidated, became highly efficient. And so any corner shops that wanted to get their hands on vapes were very easily able to get their hands on vapes. This regulation really forced them to take vapes seriously. That's what it had the effect of. Before then, the tobacco guys were competing with us. They were competing with entrepreneurs. They were competing with all sorts of people, Chinese guys, all sorts of people. But now this forced them to consolidate their operations, streamline their distribution processes, and they've done an excellent job. So after 2024, we saw quite a number of large Chinese companies ship over tons of disposables and base Chinese reps here in the country distributing them. And they probably had hundreds of thousands of vapes at their fingertips because they were trying to sell them in lots of 10,000 at a time. That was before the black market had really, just at the beginning of the firebombs and all this. And then between 2024 and now, we've seen those Chinese distributors sort of go back, get rid of their stock and go back. And for the most part, all we see now is the tobacco guys. And the other people that are out there distributing them are more long-term Chinese students sort of thing. And they're working in partnership with these factories over in China that are sending them the stock. And they're, doing it on the side as well as their studies and things like that. Those Chinese guys and the tobacco guys are existing, they're existing together, no problem. The Asian guys are not, their market share is so small that they're not affecting the tobacco supply chain, which is extremely efficient. It's extremely efficient. It's easier to get vapes now here on the ground than ever before. If you're a corner shop, you've got a list of people you can get it from. No problem. And so I'm pretty sure that's it. I didn't read any of my notes. I kept trying to orientate myself, but I couldn't. So yeah, I think that's about it. Thank you. I'll give it to you later.
Jeez. Thanks, Rob. That was fascinating. There was a bit in there that I didn't know. We're going to have another crack at bringing Pippa online now. Can you see if we can bring her up?
All right, just seeing if I'm up on the screen. Hello, and thank you for having me here today. It's an absolute privilege. So thank you to the Libertarian Movement, thank you to Ash Blackwell, thank you to David Limbrick and everybody else involved in this fantastic summit today. Can I just at the outset maybe introduce myself? Hi, I am Pippa Starr. I am the director and spokesperson of a fast-growing movement that we call Alive, which is an acronym for Australia Let's Improve Vaping Education, because it's quite obvious, as you'll hear me read through today, that we certainly do need some improving in vaping education in Australia right now. So, let me also state at the outset, we are not funded by any other associated or other entity other than the safe and nicotine consumers of Australia. We're not associated with big tobacco. We're not shills for big tobacco. In fact, we're done with being associated. Every person who advocates for their right to remain smoke-free is often tarred with the same brush as being some big tobacco shill. Nothing could be further from the truth. We are the consumer vapors of Australia. We are the ones who have found a pathway off smoking. We refuse to be told what to do and how to remain smoke-free and to be forced back onto smoking once again, as we've seen happen sadly and too much, particularly over the last year and a half or since the beginning of 2024 with the Health Minister's rollout of bills. So let me get back on track. Look, I, like most people, unfortunately, think about somebody who's passed from a related illness to using a tobacco-related product. But as one Professor Becky Freeman, who's a well-known around these particular policy measures, said in a Victorian parliamentary inquiry, vaping isn't tobacco, and she was actually right for once. Big tobacco killed my grandparents. I don't want to see another person die from big tobacco. None of us do. So we found a pathway off cigarettes. Firstly, let me acknowledge that there are hundreds of thousands of Australians across this great wide open land of ours, from Tennant Creek down to the back blocks of Mackay to Echuca, Tasmania and further. Hundreds of thousands of us have found a pathway off smoking, only to have a system at the moment that appears to really encourage vapors to return to cigarettes. And I'll explain a little bit further as I go here today. Look, firstly, let me touch on my quit story very quickly. I've been smoke-free for about 9 years thanks to vaping. I went to my doctor and my doctor said, look, Pippa, if you do not quit smoking, I can't give you this life-dependent medication anymore. So there was a new medication I required to help keep me alive. Unfortunately, there was a clash with that medication that meant if I had kept on smoking, the likelihood of me dying from a stroke or dying prematurely from a stroke or a massive blood clot was massive. Absolutely massive. Sure, there is that risk when you're smoking anyway, but along with this medication would have been absolutely massive. So I had a choice. I had to have a life. I had to have this life-important medication and found a pathway to quit. Thankfully, I found vaping just at the right time. I was able to go back to my doctor and let her know that I've found a pathway of smoking with vaping. She didn't know much about vaping at that particular stage, but she did her research. And the great news was her partner, who had been smoking for over 30 years as well, had also had her research passed on to her, and she was able to quit smoking in the same year that I did, which was great news because they were able to run marathons together, which I think is just an absolute showcase of the power of being able to share the proper information. So let me say that I don't say that vaping is risk-free. We know that there are some small risks, but again, I'll get into that as we go. Look, what do we do at the Alive movement? We are those vapors who have basically been referred to as snowflakes and worse. We're the ones who have had enough of the propaganda and the misinformation and misleading information that seems to be running through a lot of government channels. We've had enough. We've got together as individual advocates under the same banner to create a movement, and a movement we are creating. We have so far already, since May last year, we've coordinated and collaborated to organise the biggest adult vaping survey that at least I know of vapors, of adult vapors, let's be clear, in Australia, as over 96% of all daily vapors are adults. Let's be clear about that. We're not going to be thrown under the bus anymore, guys. We are actually recording data, information of every word said about vaping across Australia. Every cent being spent on vaping policy across Australia, we are monitoring and we are rebutting. Stay tuned to our website for more information on that. There will be living website pages which will be holding this sort of information and holding everyone from politicians to media and grand farmers to account. So, where are we at so far with all this? The sad thing is, as I alluded to before, there are too many people, returning to smoking. We have had, the government's had ample warnings about this. There's been ample inquiries about this, and look, let me just give you a couple of key quotes on some examples of what vapers have said since legislation have come in, and we've the vaping products that once were able to get to from shops like Rob just spoke about so well, they just couldn't get their hands on anymore. One person says, "I'm done with vaping. The ridiculous hoops that I have to jump through now. And what is even worse is the outright price gouging these online pharmacies are charging now. On my last vape now, then it's back to the rollies for me," says a disgusted 56-year-old. I'll skip one for the sake of time. This is one of the saddest ones. "I'm smoking again after I quit with a vape for over 6 years. My COPD is getting bad from the smokes, but any vapes you can find are super expensive. It's ridiculous." And he's referring to the pharmacy vapes. The vapes that are limited in flavours and price through this ridiculous pharmacy-only model. Look, we see all sorts of statistics here at Alive. We see the wastewater nicotine reports, and they indicate that the smoking rate declines may not be as great as what is currently being reported. And I know that's a controversial thing to say. Look at the wastewater reports. There isn't much nicotine being wasted out of these illegal disposable vapes. It's the cigarettes from the cigarette butts that leach into the drains that they pick up. When people have a disposable vape, they vape it, they're done. Look, the other sad thing is, got a report, is that Butler even said himself just a few days ago that half or 50% of over 30s that were vaping are no longer vaping. Sadly, I know from the survey that I just spoke about earlier, we know that chances are well over 90% of them would have returned to smoking. And with that, we are also seeing another recent figure coming out stating that 66 people are dying from smoking-related illness every day. Guys, that was about 60 only a couple of years ago, and in the 50s a couple of years before that. The death rate from smoking is escalating. We have a problem here. Let's put this in perspective. If you can imagine the biggest packed MCG crowd down there in Victoria on grand final day or on Boxing Day test, every 4 years there's someone dying from smoking. Do you think we need to have a look at some sensible measures around tobacco harm reduction and listen to consumers? Because we're sick of being ignored. We've been ignored for way too long. We've had laws made about us that aren't about us. And we say, nothing about us without us. How many people have died from vaping? Scientifically, I mean. Let's get it down to nicotine vaping. I'll give you a little hint. Donuts. Zip, zero, zilch. We see the public waste of taxpayers' money of well over $1 billion spent on misleading people about vaping. Let me give you a couple of examples. We see silly ads saying that, oh, you could be vaping things like weed killer. Now let me tell you, I've put my e-liquid on the weeds outside and they're not dying. They say there's things like insect killer in vapes. I've tried pouring e-liquids, as stupid as that sounds, on Louis the Fly, just laughed at me and flew away. Because it's not true, because it's an exaggeration. Again, it's about the dose making the poison. And there's exaggerations about formaldehyde. Everybody has a hint of formaldehyde in their mouth. People wouldn't eat an apple. People would not eat an apple if they knew there was cyanide in an apple. What? And this is the type of egg they make. Of course, in an apple, it's just a micro trace. But it gives you an example of the type of ridiculous exaggerations and misleading information that is being handed out to the public. And even worse is scaring smokers from wanting to find a way to get off the smokes where vaping may have been a useful tool. In fact, it's the most popular quit method in the world. It is the most effective quit method in the world. Don't trust me, trust the science. I've got it all on the website. Trust the gold standard, Cochrane, the Cochrane Review. Look, we the consumers, we've written to public inquiries, politicians' offices, the media and more, and warned of this inevitable black market. Yet we are ignored or often referred to as big tobacco lobbyists. We are sick of the prohibition and its effects, and there will be many who will be watching this and saying, vaping isn't prohibited. You can go to a chemist in 5 out of 7 states, and in the other 2 states go and get a doctor's prescription and get 1 of 3 flavours on an overpriced vaping product. Sure, they might say that, but let me tell you, it is prohibition. Let me make this point very clear. The great Winston Churchill, during the early 1900s, alcohol prohibition in the US, when he was travelling over there, yes, he too had to get a prescription before he could get his alcohol. We see the 220, actually there was one just come through in the last day or so, probably 221 fire bombings that have been caused not only by illicit tobacco. Vaping is the other half of the story, guys. These shops are basically half illicit tobacco, half illicit vape sales. Let's not forget that. We see the innocent life that was lost due to this criminal market. We see young children being affected by smoke inhalation in their beds as they are being firebombed from a store right below. We see the businesses, childcare centres, educational spaces, as well as community hubs affected by tobacco and turf wars. We see the sickening effects of bad policy, which is costing small businesses their livelihoods. Many small businesses can't even get insurance. The current government have already lost 27,000 jobs under their government. What? We'll just blow a few more up to exacerbate another problem, as we've already seen across Australia, and they can't even get insurance, devalue adjacent properties and worse. We see that legal vape shops, like Rob was explaining that he had earlier, have been legislated out of business, causing the very people who helped us, the nicotine, the safer nicotine consumers, they helped us quit smoking. And we've got to see them go to the wall, many bankrupt. Thousands of jobs have been lost. No compensation from the federal government whatsoever, not a cent. Thousands of jobs lost. Hundreds of businesses, good, previously legal businesses, prior to July 2024, sent out of business, governed or legislated out of business. We have been stigmatised as consumers. We've been stigmatised and ridiculed by others on the back of misleading public health campaigns that I referred to earlier. This has all gone way too far. The prohibitionist policies that were allegedly put in place to protect the youth are clearly failing. The levels of enforcement of illicit tobacco and vape outlets are never going to be adequate, as this is always going to be an ongoing game of whack-a-mole. We've already seen in the last few days Mark Butler announcing another further 160-odd million on enforcement. What are we got to do? Wait till another $6 billion or so gets wiped off the taxpayers' hard-earned money while there are people who can't even afford to live or get an accommodation in a cost of living crisis. It's absurd. We were told that the prohibitive laws on vapes were to protect the youth. Yet I can show you how publicly funded campaigns were shown in schools 3 years ago that taught kids how to vape and where to buy them. If you want more of that information, please contact me after this talk. Ridiculous. We, the adult consumers, are the major stakeholders and sick of not being heard and being disregarded. We even went to Mark Butler's office recently to present him with a fire extinguisher and a fire blanket, and still we had no reply to the letter we posted him that respectfully outlined the flaws to his vaping policies. Look, what do we, the consumers, need? What's our policy? What do we need? Look, it's based around 3 key pillars. We need access. We need access to the tobacco harm reduction products that are going to help us quit smoking, like vaping, snus, heat not burn, pouches, etc. We need the truth about these products to be told. We need results, because only when those first 2 pillars will happen, the 3rd pillar will happen, which is results where real smoking rates will fall. We need to implement evidence-based regulation for vaping products to ensure they meet stringent safety and quality standards. We need to differentiate taxation policies to reflect the reduced harm of vaping compared to smoking, incentivising smokers to switch. You know, we're not saying, we're not incentivising people to say, yeah, you must vape if you're a smoker, saying, hey, as part of a suite of measures, of course. Ensure adult smokers have access to safer alternatives by maintaining legal, regulated retail and online channels. Introduce targeted youth prevention measures that deter underage access without limiting adult options, and more importantly, not lying to our kids about the effects of vaping as well. We don't want them going home to their parents who have found a pathway off the cigarettes, as I and hundreds of thousands of us across Australia have, and telling their parents after what they've learnt in the schoolroom that maybe that vape sounds like it's as bad or worse than smoking. That would be a tragedy. And only to have that parent return to smoking, can you only imagine? We need to launch comprehensive public education campaigns to address widespread information and build trust in harm reduction strategies. Look, we were sold by our government vaping prohibition policies that they said were to protect the children. That 3.5% of daily experimental vapers that James talked about before. We're told that we protect these from big tobacco hooking a whole new generation. Well, the only big tobacco vapes are in chemists, ladies and gentlemen. They were never in Australia beforehand. If Mark Butler was so sure big tobacco was all behind this as some crazy conspiracy theory that apparently or it appears that he may have, well, why hasn't he held big tobacco to account? Why hasn't he brought them to justice? I'm still waiting on an answer from that, Mr. Butler. The 4% of daily teen use of vapes is in rapid decline based on recent figures. Well, that's 3.5%. While poor government policy is causing the former smoking vapors, that's 96% of the population back onto the smokes, the hundreds of thousands. Yep, I've touched that. Look, for the health of our great nation, this must stop now. Australians are told that vapes are a big tobacco ploy, yet big tobacco vapes are the main vapes that are being sold by chemists, as I just touched on. Vaping was created because by Heinrich, who basically brought it to its popularity, if you like, 20 years ago. Keep in mind, in that time, not one death from vaping. It was created because, and popularised, because no big tobacco or no big pharma company could or would. Very important thing to consider. Big tobacco may have got onto the back of vapes only once things got a little bit more popularised because they wanted a slice of the pie. Not necessarily a bad thing, is it? That they want to sell a harm reduction product instead of one that kills 2 out of every 3 people. So look, policy on vaping products needs to be based on evidence, not exaggerations, misleading claims, or ideology. The evidence. The evidence is clear. The harms from smoking come from the smoke and the tar, not the nicotine. Vaping contains less than 1% of the carcinogenic material compared to smoking. Less than 1%. And is at least 95% less harmful than smoking. As the head of the Cancer Council recently said in a federal inquiry, the head of the Cancer Council, Tanya Buchanan, there is no good evidence that vaping causes cancer. And as I said before, as Becky Freeman said, vaping is not tobacco. We are the vaping consumers of Australia. We don't want to smoke. We don't want anyone to get hurt through foolish laws as they are now. We want to remain smoke-free so we can enjoy another day with a loved one, because that is what it's all about at the end of the day. Don't we, as Australians, deserve to have another day with a loved one with sensible laws? Look, that's why we say let's work together to develop informed, balanced policies and prioritise public health over ideology. Australia, now is that time. Australia, let's improve vaping education. Thank you. Yeah, so thank you.
We good? Thank you. Thanks for that, Pippa. I've done the hard work of advocacy before. I spent probably about 5 years doing that kind of thing. Before, we good? Before I worked for David. And I just want to share a quick story of how difficult it is in this space to think about how you might fund that advocacy. So when I was representing the Australian vaping community at the Global Forum on Nicotine in Warsaw in 2018, there was a meeting of an organisation called the International Network of Consumer Organisations. And that was all the different kind of vaping groups and consumer groups from all over the world, from Paris, from Sweden, from Iceland, from India, from Thailand, all of the enthusiasts around e-cigarettes that had formed networks of communities to advocate for their needs. And I was invited into a meeting on behalf of the Australian vaping community, where we had a lengthy and complex discussion about whether that organisation should accept funds from the Foundation for a Smoke-Free World, which was set up by a tobacco company, Philip Morris International, to try and promote their shift to alternative nicotine products, which they took as a company. Now, that's a complicated equation. As an activist, you're like, well, we need some resources. We would love to be able to pay somebody rather than asking them to work, 20 hours for free every week. We'd like to be able to fund people to attend a conference, to do this or that. But if you take money from the foundation from a smoke-free world, is that going to then impact your credibility and make you look like you're just a front for big tobacco? So it's a complicated equation. So Pippa and her organisation are primarily run by volunteers with very little funding and, I suppose, enthusiasm for the potential of tobacco harm reduction and vaping to reduce the harms of tobacco use, and probably a good bit of spite for the government and what they've done to vapers and to the vaping community and sector. So thank you, Pippa. That was a very long-winded way of saying thank you. We're going to take a short break now. For people in the room, we'll probably take about 10 minutes. For those of you online, same again, make yourself a cup of tea, go to the bathroom, whatever you need to do. For those watching the stream, you may see us testing some of the tech to see if we can get some of our speakers up before the next panel. And we'll be back shortly. Thank you. We'll get everyone to wrap up their conversations, start coming back to their seats. I'm very excited about the next session, where we've got one of Australia's and one of New Zealand's leading experts on vaping policy speaking to us. So we'll kick off in just a moment. Okay, Rob. And then we'll go straight into Alex. Okay, we live again, Rob? Okay, welcome back everyone. Hope everyone enjoyed that short break to do whatever they needed to do. I actually left my notes off, but it's fine because I can do this introduction without it. I'm really excited to introduce the next speaker. I've introduced him on panels before, and I always find it a little bit difficult because his list of accomplishments and credentials in the drug and alcohol space run for so long, it would be quite a long introduction if I gave all of them. When I was involved in student activism, we referred to him as Yoda, kind of like the old master of drug policy in Australia. He's the former director of drug and alcohol services at St Vincent's Hospital, helped found the National Drug and Alcohol Research Centre, was a former president of the International Harm Reduction Association, and has had probably one of the most significant impacts on drug policy in Australia than anyone I can think of. So if our tech runs smoothly, we'll bring Alex Wodak up on the screen.
Thank you very much, Ash, for inviting me. And it's a very great pleasure to appear with Marawa from New Zealand, who has been in this battle for longer than I have and has fought that battle on the winning side, whereas so far that has eluded me. I've been asked to talk about myths of the tobacco wars and also what the alternative arrangements could be, and I will do that. But first, I would like to begin by talking about the big picture, because it's the big picture that is so important and that really informs what we do about the myths and what we do about the alternative arrangements. And the big picture is that we are losing comprehensively in almost all countries, not in New Zealand, not in the United Kingdom, although just recently there have been some setbacks. But most countries in the world, tobacco harm reduction is going backwards. Not in every country, but in most countries. And we are losing comprehensively in Australia, and have done since 2011, when Health Minister Nicola Roxon decided that although she recognised that vapes were not as dangerous as deadly cigarette smoking, nevertheless, she was going to more severely restrict vaping than the smoking, than the availability of cigarettes. And that arrangement, that objective has held in Australia from 2011 up till the present. So for 14 years, we've held to that arrangement. And that is insane. Now, in what ways are we losing? Well, the health establishment still agrees with Nicola Roxon's view in 2011 that we have to make vaping more restricted than cigarettes. We have to make the safer product more. We have to restrict that more than the more dangerous product. A product that kills 2 out of every 3 long-term smokers, that kills 8 million people a year worldwide, that will kill 1 billion people worldwide by the year 2100 from now. Just to put that into perspective, the Ukraine-Russian war that is currently being waged has killed somewhere between 0.5 to 1 million people over 3 years. And the war in Gaza has killed at least 45,000 people, probably more than that. And the Hamas incursion into Israel on the 7th of October 2023 killed 1,200 people. So we read all about that again and again, but this issue of the tobacco wars hardly ever gets covered from an objective perspective in Australia's media. Australia's media has been partisan from A to Z from the beginning, although this year, 2025, some of the media are starting occasionally to be a little bit more objective, and News Corps publications are more even-handed than most, and I think the most partisan are the ABC and the Guardian. Pains me to say that. Nine Entertainment is somewhere in the middle, but is still pretty partisan, hostile to tobacco harm reduction. Public health in Australia is 99%, if not 100%, hostile to tobacco harm reduction. And all the health organisations and charities are hostile to harm reduction, with the exception of Harm Reduction Australia, which is also the only organisation that does not accept a cent, apart from JobSeeker, it doesn't accept a cent from the Commonwealth Government. I think that's pretty significant. But all the others do overtly and covertly support or some rather oppose tobacco harm reduction. Now, that's the lie of the land. What about the evidence? Well, the evidence is very clear and has been clear for at least 5 years. And we'll talk about this a bit more when we talk about myths. But the evidence it could not be clearer. The evidence in these kind of scientific debates is never 100% zero, but the evidence is overwhelmingly in support of tobacco harm reduction, as it was for car seat belts, airbags, motorcycle helmets, needle syringe programs, methadone treatment, slip, slap, slop, all of those harm reduction interventions which have been proven to be so effective and safe and cost effective. But none of them will have the benefits of these harm reduction benefits that we would like to apply for tobacco. Now, what's missing in all of this analysis, and missing in most analyses, is market forces. And you'll be pleased to know, interested to know, that Goldman Sachs in the United States about a week or 10 days ago published an analysis that this year, 2025, smoke-free products in the United States will surpass combustible cigarettes in terms of volume, and in 10 years' time, in 2035, smoke-free products will surpass combustible cigarettes in terms of both revenue and profits. Now, the world of tobacco producers is divided into the traded cigarette companies, who are dominated by the non-traded government-owned cigarette companies. And the traded tobacco companies are very interested in tobacco harm reduction. So far, the government-owned tobacco companies, which actually are responsible for a larger part of the global market, so far they haven't been interested in tobacco harm reduction, although the world's largest tobacco company, the China National Tobacco Corporation, 100% owned by the Chinese government, owns the largest portfolio of tobacco harm reduction patents. And that would have cost billions and billions of dollars to amass that portfolio and generate that portfolio. And that kind of investment could not have happened, I believe, without the approval of the owners of the Chinese National Tobacco Corporation. That is the Chinese government and Chinese Communist Party. So one of these days, the Chinese National Tobacco Corporation will flick a switch to harm reduction and will swamp the world's tobacco market with harm reduction products. We're not there yet, but this is one way in which the tobacco wars could end, because when and if the Chinese National Tobacco Corporation does do that, this debate will be over. Now, there are 4 important components to the tobacco wars issue, and they are smokers, producers, investors, and the rest of us. Now, if we look at smokers, they behave much the same as other people who use drugs. And we know that when other people who use drugs get told that their drug is pretty dangerous and they're better off not using it, there is an effect. Some do give up or use less, but the effect is very disappointing. On the other hand, when they are given an alternative, which they find attractive, affordable, and available, they switch from the high risk to the low risk option. And this is indeed what's happening with smokers around the world. They are switching in ever increasing numbers from high risk to low risk products. And we now have 4 products on the market, 3 of them only available this century. The oldest product, snus, from Sweden, which has been available for 200 years, but wasn't taken seriously until this century. And so those 4 products over the last 15 years have already managed to capture 10% of the international market share of nicotine and tobacco products. I think that's pretty impressive. I don't have a background in business or commerce, but it seems to me that 0 to 10% in 15 years is pretty impressive. And the speed of that capture is accelerating. So what we need to do to speed that up is to make the other options more attractive, more affordable, and more available. It's as simple as that. Encouraging news about the tobacco companies is that, particularly the traded tobacco companies, the government-owned ones, as I mentioned, are pretty useless from this perspective. But the traded tobacco companies are increasingly showing us signs of hope. In January 2017, Philip Morris International, the world's largest tobacco company with a market capitalization of around about 150 billion US dollars, switched on its new website, which said that it was aiming to switch from combustible cigarettes to smoke-free products. It may not have used those exact words, but that was certainly their intention. And I recommend that you check on what I'm saying, check the Philip Morris International website. You'll be astonished at the things they say. Even better, listen to an interview where Ethan Nadelman, the kingpin of harm reduction and drug law reform, interviews Andrei Kalantzopoulos in about July 2023 on his podcast series called Psychoactive. And it's astonishing what Andrei Kalantzopoulos reveals in that interview. And he is very open, seems to me, extremely honest. So words are all very well, but are these being manifested in actions? Yes, they are. So in 2015, smoke-free products accounted for 0.2% of the revenue generated by Philip Morris International. By 2024, smoke-free products accounted for 40% of the revenue generated by Philip Morris International. So they had increased 200-fold in a matter of 9 years. That's pretty impressive. It's the most rapid transformation of any tobacco company. And congratulations, Philip Morris International. And that's why it's obscene that people like us, as Ash just talked about a few minutes ago, have to hide or not have any connection with the tobacco companies when they are the ones who are now behaving honourably. It's hard to credit this, but the tobacco companies and tobacco control have actually switched places. The tobacco companies are generally pretty honest these days. Tobacco control, unfortunately, lie through their back teeth. I hate saying that, but that's the truth of the matter. So the first group was the consumers, second group was the producers, third group is the investors. They're a key group because if they don't like a tobacco company switching from combustible cigarettes to smoke-free options, that'll be much harder for the tobacco companies to make that transformation. But when tobacco analysts line up the tobacco companies and rank them according to the speed with which they're transforming from combustible cigarettes to smoke-free products, they find that there's a straight line correlation between the speed of that transformation and the share price. So what that really means is that investors, presumably, are prepared to pay a premium for companies that are transforming more rapidly. So first group, consumers, tick, very encouraging. Second group, producers, tick, very encouraging. Third group, investors, tick, very encouraging. Fourth group, the rest of us, and this is where we're in a mess. This is where the World Health Organization has got it wrong, as it did about needle syringe programs and drug harm reduction in the last years of the 20th century, unfortunately. This is where Bloomberg and Gates and many other distinguished groups have also got it wrong. Now, unfortunately, also, this is where Australia has got it wrong, and many other countries have also got it wrong. But they simply can't keep that going. I love quoting Herb Stein, who was one of President Nixon's economics advisors, and he used to say that things that can't go on forever don't, and this can't go on forever. Now, one of the things that the opponents of tobacco harm reduction have done to try and slow down the transition from combustible cigarettes to smoke-free alternatives is to come up with these myths. And personally, I don't think we really should spend much time talking about these myths, because the myths are obviously bunkum, they're baloney, and I suspect that our opponents know that only too well. So some of them even have the gall to say that vaping is more dangerous or as dangerous than cigarettes, smoking cigarettes. Now, how can that possibly be? Cigarette smoke contains 7,000 chemicals. These are at high concentration. They include 70 carcinogens. They include highly dangerous carbon monoxide. And vaping aerosol contains about 100 chemicals, generally at low or even trace concentration, and doesn't contain carcinogens or carbon monoxide. So this is so obviously bunkum. Why should we even debate it? And the fact is we can't debate it, and the reason we can't debate it is our opponents realize they can only lose a debate if they enter a debate with us. So for the last 5 years, they have refused every invitation to have an open and honest debate or discussion in private or in public. Then there's the gateway hypothesis. The gateway hypothesis more or less says that well, not more or less, it does say that vaping is causing an increase in smoking in young people. But what we're seeing is that as vaping has gone up in countries like Australia, New Zealand, United States, and many other countries, what's happened is that cigarette smoking in young people in their 20s and in their teens has fallen to historic lows that we haven't seen for many, many decades. So this is 100% bunkum, nonsense. What in fact our opponents are doing is they're a Trojan horse for big tobacco. They are encouraging the use of deadly cigarettes, because if you are opposed to vaping and other tobacco harm reduction options, then what you are in fact doing is encouraging cigarette smoking, because the two are substitutes for each other. Push down on one, you push the other one up. Push down on the other, and you push the first one up. It's painful, this non-debate. So we could go through each of the myths, but I personally think we don't really need to. It's abundantly clear that they are myths, and we don't really need to spend time discussing them. So what arrangements do we need to have? Well, the arrangements we need to have are quite simple. We can make them as complicated as we can, as you like, and go into the details as much as you like. But the first principle is the most important principle, and that is that we need to have vaping, the safer option, more available than cigarette smoking. And that's what the New Zealand government, with the four major parties in New Zealand at the time, decided together on August 2020, and that's slowly what happened. And they decided that vaping would be easier to get than cigarettes, and they set about doing that. And as a result, my colleagues and I published a paper in Addiction a month or two ago, which is a very prestigious journal, highly regarded journal. And what we showed is that the smoking rate in New Zealand from 2017 to 2023 fell by 10% per annum, compared to only 5% per annum in Australia. Secondly, we showed that amongst the most disadvantaged New Zealanders, including New Zealand Maori, compared to the most disadvantaged Australians, including First Nation Australians, the smoking rate fell 3 times faster in New Zealand than in Australia. What we also showed was that there was no evidence in New Zealand for a black market in vapes, whereas there's plenty of evidence for a black market for vapes in Australia, unfortunately. And we've now, the black market for vapes merges with the black market for cigarettes and tobacco, so you can't really say that it's one or the other. And we're now up to 3, 4, or 5 deaths, including the death of an innocent bystander who just happened to be in a house that got set on fire by accident. It was the arsonists set on fire the house next door to the one that they were meant to set on fire. So that's where we are, and so we now have this booming black market, also assisted by the sky-high cigarette taxation, which has generated a booming black market in black market cigarettes. So legal cigarettes are about $45 a packet, I gather, and the black market cigarettes are about $15 a packet. Now remember that smoking spans the socio-economic spectrum, but is concentrated in low-income and disadvantaged populations who not only have higher smoking rates, but also smoke more cigarettes per day. And Australia has been through a decade of sluggish wage growth and also many years of rising cost of living. And so Australian governments, both Conservative and Labor, have put this impost onto low-income and disadvantaged Australians of sky-high taxation, and haven't finished yet because there'll be a 5% increase in cigarette taxation in Australia on the 1st of September 2025. So it's a pretty dismal picture, and the only thing I can say to you is that I've been involved in campaigns like this for new interventions in drug harm reduction since the early 1980s in Australia, and I've also been very involved in worldwide harm reduction activism. And they all have a similar kind of trajectory, and we always start off way behind. But the fact is we win almost every single battle. We don't win them all, but we win almost every single one. And we will win this one. And whether it is because of economic forces or for political reasons, who knows, who cares, but we will win this one eventually. So far, all the things we've tried to do to hasten that victory have not had the outcome we wanted. But one of these days it will happen, and I can't wait to see that. Now, I don't want to take up more of Marawa's time, so I'll pause. I'll stop here, and I'm waiting to hear what Marawa has to say.
Thanks for that, Alex. It's always great to hear your perspective. And as depressing as it can be when we're in this situation where we have an abundance of bad policy and the harms that it's causing, as Alex explained, for somebody who's been around and seen this thing play out for as long as he has, victory is inevitable. I think the role of anyone who's involved in the politics and advocacy in this space is to try and shorten the amount of time and limit the harm that happens until we actually embrace the inevitable, which is sensible and compassionate policies. Now, our next speaker comes from a jurisdiction that's kind of done that. If we were to look anywhere in the world at somebody who's gotten, of a jurisdiction that's gotten probably the closest to like good policy when it comes to certainly vaping, potentially tobacco as well, we don't have to look very far. We can look just across the Tasman at New Zealand. Our next speaker is Professor Marawa Glover, who has done a lot of research on smoking cessation and a lot of work in that space, particularly with the Maori population, which is relevant when we're talking about reducing the harms of tobacco use in society. Here in Australia, as in New Zealand, Indigenous smoking rates are far higher than in the rest of the population. So I think we've got you on stage now, and I think we're ready to go.
Thank you. Can you hear me okay? Hopefully you can. Thank you to the Honourable David Limbrick for inviting me to join you for this important summit. I've been making notes, so please excuse me sort of making sure I stay on track with those. We've been treated to some excellent presentations, and on Dr. James Martin's talk, I just wanted to add some experience from New Zealand. So one of the reasons that New Zealand introduced sensible regulations on the import and sale of vaping products was because we had an increasingly violent and prolific black market happen here as well, with ram raids of shops and robberies of tobacco, and vaping shops were also being hit. People were being injured. We didn't have firebombing, so maybe we don't have such a large, organised crime syndicates here. But so that was one of the reasons, and I think it's definitely time for Australia to look at the New Zealand evidence and what we have achieved. Now, Jordan's talk was very informative and really enjoyed learning from him. He talked about the police being frustrated, and so they should be. You know, they're being diverted from their core purpose. I too have argued that vaping should not be a police matter. Public health has co-opted police time and resources to push their own agenda. And it's not a health agenda, I'm sorry to say. If we really wanted to help people to stop smoking, to begin to reduce the 7 to 8 million deaths worldwide per annum that are attributed to smoking tobacco, we would embrace and encourage switching to vaping, oral nicotine products, and even heated tobacco products. Public health worldwide has been infiltrated and weaponized to drive a globalist, totalitarian agenda. It's not about health. It's a political movement. Vaping saves lives. And Pippa's talk, you know, gave you a lot of information and talked about the evidence. So I don't need to go over that. The crime, firebombings, and misery caused by this, it creates chaos and fear. And this is an important strategy used by that agenda. They're trying to destabilize our cultures, stigmatizing, criminalizing ordinary people who are doing nothing wrong. It drives division in society, in our communities, and even within families. The message is do as I say or else. And the lies about vaping, which Pippa talked about as well, the disinformation is creating confusion. You know, an increasing number of people don't know what is true or false anymore, and they feel powerless. And I know this from my Voices of the 5% study. The evidence proving the superiority of vaping to help people stop smoking has passed a tipping point. We're past that, and more evidence comes out every day. It's been 20 years. Some people I know have vaped for 20 years, and we now have a lot more people who have vaped for, say, 10, 12, and we're now getting epidemiological evidence showing the reduction in smoking-related diseases in some countries. And it's way more than the tax ever managed to achieve. And still, so-called doctors, professors, and pharmaceutical industry-funded health NGOs lie about vaping. It's as if they don't want people. Sorry, it's as if they do want people to continue to smoke, to continue to get cancer, heart attacks, stroke, coronary obstructive respiratory disease, morbidity that supports a multi-trillion-dollar worldwide industry. The corruption Jordan hinted at is that the pharmaceutical industry, the medical establishment and associated industries, big tobacco industry, and academics and universities and governments, they all making billions, trillions from smoking, and they don't want that income to be cut off. New Zealand is not immune from this, but public health prohibitionists set a 5% or below smoking prevalence goal by 2025. That's this year. The scientific evidence, and New Zealand researchers, myself included, we were among the first to do randomized controlled trials on e-cigarettes. Murray Logerson, Dr. Murray Logerson, my mentor, he did the first study on the Ruyan e-cigarette, which was a cigar-like. And the real life observation, what we saw in New Zealand, showed vaping could get us there to that goal. We saw a mass exodus of people who smoked moving to vaping, and this occurred at a faster pace among Māori, our Indigenous people, and the lowest income people, the people hit hardest by the extremely high, world high, along with Australia, tax on tobacco. Vaping, even pre-legislation, was reducing the inequity in smoking between non-Māori, non-Pacific people and Māori, between the high income and the low income. The prohibitionists here, our prohibitionist academics, they fought against the legalization of vaping, and they haven't finished fighting against vaping. The compromise in that legislation was that oral nicotine products were banned. And the government promised, then, we've had a change of government, the government promised that once smoking was below 5%, they'd then go after vaping and get rid of that as well. Public health prohibitionists, to retain their relevance here, switched to a war on nicotine approach. Last December's 23-24 statistics showed reduction in smoking had stalled, but smoking rates continued to trend down. So we went from 17% in 22-23 to 15% in 23-24, and this is just phenomenal and fantastic. And I've been working on reducing Māori smoking for 32 years. Māori smoking was 50% when I started. As Alex alluded to, another fantastic outcome is that less than 1% of 15 to 17-year-olds now smoke, and less than 5% of 18 to 24-year-olds now smoke. They always had the highest smoking prevalence, that group. The other wonderful outcome we can show is that the 20% on the lowest income are down to 14%. A lot of them are Māori and Pacific, but compare that to the 20% on the highest income. Their smoking prevalence is 2.5%. So we still have an inequity there, but we are getting that inequity down. Why did we stall? Why has it stalled? Well, again, Alex alluded to this. Basically, the mixed and outright false messaging about nicotine and the relative risk of the full range of reduced harm products. It's misleading everybody to now be as viciously anti-vaping as they were anti-smoking. And Alex talked about how a lot of people think that vaping is more dangerous. These are false messages, disinformation that is put out by these prohibitionist groups that are losing relevancy. The other group being left behind, I just wanted to add, was older people. The focus is so much on young people and underage and minors, and yep, that's important to make sure that they're not uptaking smoking and vaping. But older people who are most at risk, the people who have smoked the longest, most at risk of smoking-related diseases occurring now, they are being left behind. They are the ones most scared of switching to vaping, and we don't have the oral nicotine products. You can import for your own use, but so there's evidence from around the world, and James, referenced this. For further evidence, you can look at Sweden, Iceland, Japan, that only has the heated tobacco product, they have almost halved their smoking prevalence. Norway, even the UK, and even the USA, that never signed up to the World Health Organization Framework Convention on Tobacco Control, they're doing fantastic. And they've reduced their smoking prevalence at a pretty fast rate as well. So I hope that gives you a little bit of insight. Our policy isn't perfect. It is a prohibitionist policy. We have a lot of public health academics who are all about zero smoking, zero vaping, zero alcohol, and now have a zero alcohol goal. Zero, you could go on and on, zero sugar, zero gambling. And they are not basing their policies on evidence. Thank you. I hope we have some time for questions.
Wonderful. Thanks so much for that and for agreeing to participate at late notice. What we might do now, we won't take an extra break. We'll keep things moving so we can wrap it up and you lovely folks can go home. What I might do is just go to our online speakers, Alex and Marawa, just with a couple of questions about what we need to do to get things right. Like what are the key policy considerations or things that need to change here in Australia to have something approaching sensible policies. So I'll go to Alex first. What would be the 2 or 3 key things that Australia needs to do to set us in the right direction on tobacco and vaping policy?
Well, I'm conscious that I really took up a lot of Marawa's time, so I'm uncomfortable taking up even more. Let me answer your question by saying that I know where we ought to end up. And that's an important point that we all ought to be conscious of. Unfortunately, it's not in the state realm, it's in the federal realm in our system. And that is that this issue has to go from the Therapeutic Goods Administration, which hasn't done well in it, and it has to go to the ACCC, and I can never quite remember what the ACCC stands for, but it's someone might remember. And the reason for that is that it's really that's where cigarettes are, for example, and so that's where vaping should be. It's a rival to cigarettes, so that's where we have to end up. Now, what we have to do is get to that stage by either a state breaking away, and some of the states have broken away, unfortunately broken away on the draconian side. We haven't really had a state or territory breaking away on the more realistic approach, but we have to have a state or territory that breaks away and that causes a cascade around the country. The most likely one to do that is the ACT, the Australian Capital Territory, I think, because they've got the impossible position to defend, where it's okay if you're walking around the ACT with a little bit of heroin or cocaine or amphetamine or all of the above in your pocket, but God help you if you've got some mango-flavoured nicotine juice and a vape machine in your pocket. Then you're up for, I think, 2 years imprisonment and $20,000 fine, or whatever it is. I mean, that is so patently ludicrous. So I think pressure on the ACT would help. And I know the Greens are very interested in that issue. They're not in part of the current ACT government. So Labor and the crossbench government will have to introduce that. I think that's the most likely way that we can get this to start. And what they have to do is they have to come out and say this is all nonsense and vaping is safer than smoking and should be more and cigarettes should be even more unavailable than vaping. That's what they have to do. It's not all that hard.
Thanks, Alex. I might just ask one more question to you before I throw to some of the other speakers. Do you think that, given the scale of impacts that we've seen from our current policy settings with the arsons, the crime, and I think the other thing that we're likely to see in the next substantial figures is that the smoking rate is probably going to go up in the adult population. Something that Mark Butler, our health minister, said early this week was that there'd been a decline of 50% in people over 30 vaping. Now, to me, the only way that that could plausibly happen is a significant number of those have shifted back to smoking. So I suppose my question is, will that demonstrated failure give federal politicians a little bit of space to change tack, to embrace an alternative narrative, or do you think that it's going to take a little bit more than that?
Look, governments, Conservative as well as Labor in Australia, have had so many embarrassing moments where they've had to deal with information that was showed the failure and the futility of what they're doing, and they just went on. So they'll come up with something else, and they're saying this nonsensical stuff that the draconian penalties that we've now got in Australia for vaping, and the huge resources being poured into vaping law enforcement are going to solve the problem, and it just hasn't happened yet. They'll say something like that. So they seem to be embarrassment-free. So I don't think it's going to require some kind of political adjustment. Mark Butler is said to be close to the Prime Minister. We have elections, federal elections in 2 months. And if Labor gets returned, which seems likely either as a majority or more likely as a minority government, then their minority partners could put a lot of pressure on them. But the most likely partners are the Greens, in my view, and the Greens themselves, unfortunately, seem to be divided on this issue, which is crazy. I mean, how can you be pro-regulating cannabis but anti-regulating vaping? It's nuts. And we have to keep on saying that it's nuts. It is. It's insane.
Thanks, Alex. I think you mentioned some of this before, Pippa, but maybe if you could just highlight from the perspective of the vaping community, what are maybe 3 of the key things that you would like to see in vaping policy that you think would make it attractive for vapers to participate in a legal market and sort of undermine all this organised crime and smuggling that's happening at the moment?
Sure. The first couple of points I make are sort of joined together. Firstly, we need respectable, risk-proportionate policy that allows the retail vaping market to exist legally, for a start. Let's get it out of the hands of criminals. We need a legal vaping market. We had a good one that was destroyed and replaced by a criminal one already. That's a massive mistake that's happened under this government. David Limbrick, the head of the National Party, has already admitted we got it wrong. We need the Labor government to do the same. But we not only, as vapers, expect or the inevitable, as Alex has alluded to, what will inevitably happen, which is legalising and regulating vapes. We need reasonable and reasonable regulations that the industry had been calling on for years before all these bans, for quality products and safety assurance measures on vaping products to keep the rubbish vapes out. We don't want the cheap Chinese, horrible, untested, unregulated vapes. We want to get them out of the market. But So there's sort of 2 points rolled into one. But before we can even get there, this government, the Labor government now under Mark Butler and Anthony Albanese, they need to be man enough, as David Littleproud already has, to stand up and say, we have got it wrong. We are going to have to re-educate Australia about tobacco harm reduction and the realities of what is. We need to stop the misleading, the exaggerations. As vapers, as consumers, we just want another day with a loved one. I mean, surely that's not too much to ask.
Thanks, Pippa. And I suppose it's probably good to bounce from those comments and go back to Marawa. Have you guys got those things right? The things that Pippa was saying that would really work for the vaping community. Has New Zealand got those settings right? And you know, how can Australia best learn from that example? Do we need to just hound our health ministers to, you know, take a short trip over to New Zealand and see how it works?
Yeah, sure. That would be great. You know, come over. We our economy could do with more tourists. We have specialist vape stores, and so that's it's a system, and they have to apply, and they're charged for that. We also have vaping products available at the corner store, at convenience stores. They also had to apply and pay to be suppliers of vaping products, but they're very restricted. They can only sell like 3 flavors. So people can, so this is a key thing, access. You've got to make vaping products accessible. You've got to make them affordable, so we don't have tax on vaping products. And that's incredibly important. It is a driver for many people. They're able to save a lot compared to what they were spending on tobacco. And that did help motivate people in the lower socioeconomic or low income groups to switch to vaping, even if they were concerned by the lies that are put out there. It's a financial decision at the end of the day in feeding your children. So this system, though, is set up to be able to be used to later clamp down on and reduce that access, increase the price. The other important thing that Pippa has been saying is that the products need to be acceptable to the consumer. They need to be products the consumer wants to use, not the ones the government has approved over there. You know, it doesn't have to be big tobacco products. They're the least favored. And the other thing is different strokes for different folks. So you've got to have a range of products at different systems and different flavors. And the vape stores really were doing far better. They around the world, vape stores, heated tobacco stores have helped far more people stop smoking than all the stop smoking coaches and cessation services worldwide. You know, I've seen many presentations at Global Forum on Nicotine, which is coming up again in June in Warsaw, but presentations showing how many people were being helped by vape stores. They usually have people who work there who have been consumers, who were smokers, who have switched to vaping. They have the expertise. Most people who work as stop smoking coaches or counselors and quit services, and most of the people in public health, have either never smoked, they hate it with a passion, They hate people who smoke. There's no compassion. The retail model is far more equal. It's a shop, it's a customer. The customer has power and they can go somewhere else. They don't feel disempowered. Consumers don't feel disempowered going into a vape store. They can leave and go somewhere else if they're not treated properly. Whereas with a quit smoking service, you're talked down to, they're condescending, you're sick, they're trying to help you. So I really think that the retail model is far superior, and we have that at the moment. And the current government, so our new coalition government, a Liberal government, they are looking to remove the ban on the oral nicotine products. One of the reasons for that is that the misinformation and the lies about vaping being, more dangerous than smoking or more addictive, and all of the incredible toxic lies that have been told have put a lot of people off. And we are going to need another risk-reduced nicotine product for them. So this government is looking at that, and I've heard that maybe oral nicotine products and even snus, the Swedish snus, might be legalized by next year. Don't know when though.
It's very interesting. I'll come to you in a second, Pippa. I just wanted to follow up with a quick question for Marwa. I think one of the challenges now in Australia is the ubiquity of these disposable vapes. They're what people are familiar with using now. A lot of people have only ever used them, not like your old school vapors like me and Pippa and others who use the open systems and made their own juice and all of that fancy jazz. So I feel like the challenge that we might have is if we had a retail sector that didn't have products with that level of convenience, they might not hit that desired outcome of devices that are really attractive for the current consumer groups. How is that managed in New Zealand? Do they have disposable vapes there and like these really user-friendly devices, or have people just learned to be more familiar with some of the other devices that are on the market?
The anti-nicotine, because they've moved to nicotine, the anti-nicotine prohibitionists continue to lobby very hard, the pharmaceutical company-funded ones, NGOs. They're continuing to demand that especially the disposables are banned. So New Zealand has continued to introduce some changes to the legislation. They tried to ban the disposables, and then before the law's even gone through, the manufacturers, and most of the vapes in the world are made in China, they've worked out, they've innovated, they've got round it. So vapes here have to be child-proof. So we were back to, having to click 1, 2, 3, 4, 5 to get it to go. It'll go for a certain amount of time and then it will lock. So all sorts of innovation in the product happened. So by the time this requirement of child lock and there were a few others came through, there were new devices that got around that were still disposables. So yes, the government, I think they have put through a ban on disposables. Another one they did, and this shows the ignorance in the people who are in the policy realm and advising on what needs to be done. I don't know, some of you will remember the issue with batteries and the removable batteries and people putting them in their pockets. And anyway, so there was one regulation that was you can't have removable batteries anymore. It's got to be contained within the device. not these removable ones you take out, recharge and put back in. Well, now they've changed that, and now they want removable batteries because disposables were a closed system, and you use it and throw it away. So to ban disposables, they said, now you've got to have a removable battery. So it's just, it takes a lot of time, it takes a lot of money. And as a professor of public health, I am aware that there are much bigger public health issues that need funding. There are people dying of many other diseases, diabetes, obesity-related diseases. That's going to be top. And what are we doing there? Instead, there's all this money and time and effort going into tweaking the legislation around vaping products to satisfy these very loud prohibitionists.
I sometimes wonder if maybe they're just a bit bored. maybe some of these public health figures need to get a hobby, perhaps. Pippa, you wanted to jump in before. I'll just throw to you if you had something to add.
Yeah, there was something I want to get on the back of what Mara was said, which I think is a really important point, particularly from the consumer point of view. As vapers, as smokers in Australia, no, we don't want to be told what to do. But we aren't unwilling to go and get some help to quit smoking. But you're right, through that regulated retail environment where you're invited to talk to somebody who has experienced vaping before and has become smoke-free themselves, has been a very integral part of many, hundreds of thousands of Australians who have found a pathway of smoking with vaping. But here's where I've got some questions, big open questions for those who are viewing this today. Just before the Butler government came in, the quit line, which we're all told to call and they're going to help us quit smoking and they've all got the best quit methods, not only, and subject to me being corrected, had not released any KPIs, any figures, engagement figures for who and how many people they've contacted or been in contact with and helped measure effectiveness of quitting in this country, hasn't been released. We need those figures. I think that is damn important. I'll tell you why it's important. Because I mentioned at the beginning of the new Albanese government, not far in, all of a sudden the quit line had more money than it ever had before. We need to know that we are getting results, our bang for our buck with our public health system to know that they're being effective. They do not want to listen. If you rang the quit line 2 years ago and you wanted to quit vaping, they didn't want to talk to you. All of a sudden, all this extra money seems to be thrown into the quit line, and all of a sudden they're interested in helping everybody quit vaping. So some big open questions there. We don't want to be spoken down to. We want to be acknowledged respectfully. Let's listen to what the likes of Mara have said about their experience in New Zealand, and understand that they just might actually know a little bit better. The proof is in the pudding.
Can I just add something on the quit line? So in New Zealand, they did have a KPI. They were supposed to help 100,000 people stop smoking. And when it was evaluated, they struggled and they only got to 50,000. So it was shut down. And it was given to just a general health call centre. So I think there's major flaws, theoretical flaws, underpinning smoking cessation services, at least in New Zealand. You know, in the UK, you've got a couple of areas where they're doing a great job. They've got the vape to swap, you know, so was it swap? Anyway, they're giving out free vape kits, and I see they're just claiming like a 24% quit rate. or switch rate at 4 weeks. So there's some good models in the UK, but cessation has been theoretically flawed for quite some time.
I might just share one of my own anecdotes here. Something interesting happened in, I think it was about 2022 maybe. You'll probably remember this as well, Pippa. There was a particular day where our quit services, the Cancer Council, and a whole bunch of these anti-tobacco and anti-vaping groups bulk blocked every high-profile vaping activist and advocate on social media. Like, we all got blocked on the same day on Twitter, and essentially frozen out. So in addition to what Alex was saying earlier, where they completely refuse to be on a panel or at an event like this, to have an open debate with somebody like Alex, somebody like James, they've also tried to prevent us even calling them out on social media. And the people that were doing this were generally well informed. They were linking to reports by Public Health England that demonstrated the lower harms of vaping. And they just wanted to completely silence that. So far from coming up with a pro-public health strategy to help people who are smoking to quit, they're actively burying their heads in the sand and not just refusing to listen, but doing everything that they can to try and prevent an alternative point of view from being heard at all. And then a massive media strategy followed this mass blocking event that happened a few years ago. I might leave it there for our online guests. And once again, thank you to Dr. Alex Wodak, Professor Marawa Glover, and Pippa Starr. It's been great to have your contribution to today's event. So thank you very much. And for everyone online and for people in the room, we'll bring a couple of chairs up now. We'll bring David Limbrick and James Martin back on stage and close it out with a few final comments on how we can come up with real practical and evidence-based solutions for tobacco and vaping policy in Australia. So bear with us just a moment. Perfect, we'll get to there.
Mike, all right.
Did you want to come up as well? Oh yeah, we'll get Jordan up as well. Oh, there we go. Get one each. Are we back live on the stream, Rob? Yep, we're ready to go. Okay, so maybe if we start, we'll go from right to the left as the audience sees it and start with James, and maybe just start with a couple of initial comments on some things that we can do to get the policy settings right. So what are the first couple of things that governments, federal or state, should implement to help get us out of the current mess that we're in?
Okay, thanks, Ash. Well, I think unfortunately the things that need to be done have been pretty well fleshed out, but unfortunately the federal government and increasingly state governments have been taking this in the wrong direction. I think we need to pause at the very least as a first instance, and also in future we need to decrease the exorbitant tobacco taxes that we're seeing at the moment. The main pushback there is that we've got advocates of very high levels of taxation saying that this will increase rates of smoking. I think the arguments they're making are really spurious and are lacking in evidence, because there's already, as we know, wide availability of illicit tobacco that is far cheaper than we even saw in the legal market, even going back a decade ago. So the market is already saturated with very, very cheap illicit tobacco. But what we want to do is halt more of the market going to the illicit trade, more of that market share, and the only reasonable, feasible way of doing that is by making legal tobacco products more affordable. The other really big one is we need to legalise consumer vaping products again. So, you know, as has been discussed at length already today, vapes are the #1 smoking cessation intervention. They're more effective than cold turkey. They're more effective than any nicotine replacement therapy that we have. They're so effective that if a smoker who's not intending to quit tries a vape, a certain percentage of them will go on to quit smoking because they simply find them a more preferable device. There's no other nicotine intervention that can boast that kind of success rate. And I think if public health actually invented vapes, they would be crowing about this, you know, that they've finally found the solution to one of the biggest killers of the 20th century. And I think it's, you know, pretty obvious case of sour grapes that because this was a consumer-led intervention that they, you know, have actively opposed in this country at least, that we're seeing that kind of opposition. I think as a third and final thing that will need to happen in response to the tobacco black market, or the nicotine black market in general, is there will need to be increased enforcement associated with this, but I really want to stress that, and the reason you need that is because we've got entrenched criminal supply networks and they're not going anywhere. So even if you know, got rid of the policies that created this problem in the first instance, the tobacco tax and the ban on consumer vapes, you're not going to fix the problem without increased enforcement. But the really critical qualification to that is that that is going to be completely ineffective unless you address the underlying supply and demand issues. So the increased enforcement we're seeing at the moment, that is not going to work because of the huge restriction that we have on legal forms of nicotine.
Yeah. So would that be fair to categorise that as creating a more acceptable consumer market by decreasing tobacco prices and legalising vapes, and then using enforcement to then protect that market?
Yeah, that's right. So you want a, so the comparison that's been made with New Zealand and the policies they have over there, they have quite high tobacco taxes, but they coupled the increase in tobacco taxes since 2020 with creating a legal regulated vaping market. So there was a carrot and a stick kind of approach where you said, okay, well, we want to push consumers away from the most harmful form of nicotine consumption towards this comparatively much less harmful. And as Marwa spoke to, yeah, that's been tremendously successful. Here in Australia, we have a stick in a stick approach. So, you know, it's kind of like the beatings will continue until morale improves, sort of attitude. And that simply defies reality. It is not going to work. It hasn't worked with other illicit drugs, as we've already discussed, and it's not going to work any more effectively with nicotine.
Thank you. David, so I might get you to comment on two aspects of this. Firstly, what you see as the solutions, what does the Libertarian Party propose to solve this? But also, you know, you've spent 6 years in the Victorian Parliament now, you've had discussions with people both in the chamber and privately. What do you think is persuasive in politics, both publicly and behind the scenes, in addition to those solutions?
Sure. Look, I agree with James about the end point. Like, the end point needs to be a legalised consumer vaping market for adults and changes to the taxation system. But none of that is going to happen, I don't think, until we acknowledge first that there's been a failure. And that's sort of one of the drivers of, you know, me wanting to do this today and get the message out over the internet, is that we need to acknowledge that the current policy is failing. And, you know, we've seen the Victorian government, when failure becomes so obvious that everyone acknowledges it, they do change course sometimes, and they do that. Now, the thing that's very particular about tobacco policy is it's a small minority, it's a smaller group of people. And I think one of the things that's changed recently is the idea that, you know, I might be next door to a tobacco shop and I might not be able to get insurance, or my house might get firebombed accidentally, or you know, it's starting to affect people well outside of just smokers. And I think that it's going to have to reach a point, and unfortunately I don't think we're at that point yet, where it affects a lot more people, either through massively increased enforcement, which they're sort of looking at now, they're spending a lot of money on it, through, I hate to say it, more people get hurt, more innocent people get hurt, insurance prices going up. Businesses are going to start saying, why is my insurance so high? And they're going to start getting upset about all this. So I think that things need to get a little bit worse before people say, well, actually this has been a failure. But the very first thing that needs to happen is the need to acknowledge that the current policy has failed, and the people that have been pushing our current policy need to be held to account, because they seem to just, like has been said, they just disengage from everyone, say all of these things about vaping and everything that's not true, and they seem to be getting away with it. They've got like their own little systems that are happening. They keep pushing forward with the same old stuff, but none of it's working, and it's just getting worse. And that's what we need to do, is the very first thing is acknowledge that it's failed. Now, I think, with your comment about, people in Parliament, I think a lot of people actually agree with what we're saying. They wouldn't want to get up and argue about it, but it's like lots of things in politics, it's too hard because you've got this big public health establishment that's got, these taboo things that are taboo that you're not allowed to say, like, you're not allowed to say, oh, maybe we should think about lowering tobacco excise tax. None of them are allowed to say that, but I can, and I think that's something that we need to look at as well, as like, how did we get to a point where it's so entrenched like this, where any challenge to their authority is met with disengagement and demonisation. They'll demonise people for saying these things, for speaking out against it. But I think ultimately it'll become self-evident, and we'll come to a point where everyone will just have to acknowledge, wow, it's really failed and we need to do something different.
Jordan, as we discussed earlier, your particular history, you have some insights, but also as somebody who is pretty much thinking about federal policy full-time at the moment, what are your thoughts on disrupting the current established and massively lucrative organised crime networks, and how we can do that with both policy settings at the large level and perhaps at the smaller level as well? How do we disrupt these networks?
Yeah, well, what I was just listening to James and David and their excellent responses, and so in addition to my lived experience, having previously been involved in black markets and contraband, another piece of lived experience that I'm marginally more embarrassed to share is that I used to be in the Liberal Party. And as a former Liberal Party person, I know how the major parties operate. And what I want to talk about a little bit in terms of how we're going to achieve change on this is less policy and more politics. And even though that might be a lot less interesting to the average person, sometimes I think that's, like David kind of hinted at, that's where our biggest bottleneck is the politics rather than the policy, which we know the current policy settings have failed. We know, based on what everyone here and everything that's been said before at this summit and all of the evidence in multiple jurisdictions around the world, we know what we need to do. So how do we get from where we are to where we need to be? And that's a political question in Australia. And I think that at least part of the problem we have is related to the dynamic between state and federal levels of government at the moment. We have Labor governments in both New South Wales and Victoria who are feeling the brunt of this problem from a downstream of federal policy point of view the most.
We suffer the consequences.
Indeed. So, but from a state politics level, really this should be an easy win for a state government looking to deal with this problem. They should say, this is a problem that we're being left to pick up the pieces of. It's not of our making. The federal government has left us with a shit sandwich, and this is outrageous and something needs to be done. And actually, from a state government policy point of view, that's a really easy argument because there's not a lot that the state government can do about the downstream problem, and they've been left with a monstrous policy nightmare from the federal level. Now, the reason that isn't happening is in part, as David said, because it's an issue that they can sweep under the carpet and it's not affecting enough people for them to consider it a priority. But there is also a world that I can see where, Alex shared his view that the coalition won't win government. Pippa, I know, disagreed, and she's off screen now, but I could see her shaking her head when Alex said that. I think that if the coalition were to win power, I think that you could find things at a state government level switching pretty quickly. If you had Dutton elected with a very small majority, I think that Jacinta Allen would suddenly start to see this as an issue she could play into state politics with and potentially whack an incoming Liberal Prime Minister and score political points. So the political dimension of this thing is something that could change very rapidly. Now, there's also a world, and again, I'm not picking on Pippa, but she won't like to hear this. David Littleproud and the Nationals are the minor party in the coalition. The Nationals have always been better on tobacco policy than the Liberals, and the moderates in the Liberal Party room are happy for Dutton to be pretty muscular on certain things as opposition leader, but the moderates in his own party room and the public health lobby, at the moment they don't really think the coalition's going to win either, so they haven't really been putting the screws in. But if the coalition do win and form government, the public health lobby will descend on them with the fury of 1,000 suns on tobacco and vaping policy, and they will come under immense pressure from a very organised, very well-funded, very entrenched interest group that I don't think many Australians appreciate how powerful it is and how entrenched in public funding and taxpayer incentives this industry is. The quit industry and the public health lobby generally in Canberra is incredibly powerful, and an incoming government, if there is a change of government, will come under incredible pressure to backtrack on things they've said about sensible changes to vaping policy, but also certainly tobacco excise. So I know that paints a little bit of a grim picture about the politics rather than the policy of this question, but that's my job. That's why I'm putting up my hand to run for the Senate and to get into Canberra and to make sure that whichever government is the government of the day following the federal election, that this issue and the clear policy failings and consequences of those policy failings has a champion in the Parliament. Because as we've heard all of our guests speak about, there is this kind of Cold War, wall of silence, chilling effect that this is an issue you can't talk about. And you know, if we get a voice in Parliament who has parliamentary privilege, they won't be able to stop us. So that's my mission. And it might sound self-serving to say that one of the biggest political solutions to this problem is to vote Libertarian at the next federal election, but that is, of course, what I'm going to say. So with that, I'll leave it to Ash.
That is what we would expect a candidate to say, Jordan. I'm going to ask a political question of the non-politician and non-political candidate on the panel, because I think something that came up for me when you were speaking then Jordan, and it's something that I've thought about before on this issue. Well, actually, first, before I get to that, I just wanted to acknowledge that we were going to have another guest speaker today, and that was Brian Marlow from Legalised Vaping Australia. Brian has done a lot of work in this space. He's probably one of the few people that you could think of as a vaping lobbyist, kind of representing people in the sector and knocking on doors in Canberra and trying to persuade politicians to change their mind. Which brings me to the question, while he's been doing that, I've watched his journey and worked with him on some of those campaigns previous to my time working in David's office. And the politicians whom he was most effective and persuasive with, and I don't know exactly why this was, tended to be more from the conservative side of politics. So he got support from federal MPs like George Christensen, Cory Bernardi, the Nationals are on board, certain people within the coalition, at least privately, some of them publicly. And I guess my question, and I think, James, this might be an interesting one for you. Do you think that the fact that the early supporters of vaping tended to be on the more conservative or libertarian side of politics has kind of made it, as often happens with modern politics, this binary dimension, and it's made it more difficult for parties like the Greens or the Teals maybe that sort of sit on that other side of the political spectrum to come to the table with things like vaping?
Yeah, I think that's a really great point, Ash. Yes, in short, I think it has, and I think developments in the United States have really pointed to how nicotine in general has become just another aspect of the culture wars now. So, you know, when you've got Tucker Carlson popping his Zins, and I think he's got his own brand now. It makes it very unpalatable for someone who believes in harm reduction, which has traditionally been associated with the left side of politics, to see tobacco harm reduction products and less harmful nicotine as part of that solution. So yes is the short answer, but it's been very odd actually working in this space. Being accused by people who, I previously looked up to as public health experts, but, I've copped personal abuse from academics and experts working in this area. People have accused me of being a right-wing nut job, which has, been interesting and eye-opening, despite that not really being my politics at all. But yes, in the short answer, I think yes. I think nicotine, sadly, has become another political football. But I think there's a danger here as well. As someone who's been a long-time critic of the war on drugs more generally, the war on drugs has traditionally been fought from the right side of politics. They've used and inflamed moral panic around illicit drugs of all kinds for their own political purposes. And sadly, I think that is a real danger that we're seeing with nicotine now in this country. You see nicotine consumers being increasingly stigmatized as sort of brainless, mindless addicts, rather than people who are exercising consumer choice, sensible consumer choice for less harmful nicotine products. They've been excluded from the discussion. And I think there's a real danger that you may have, as Jordan mentioned, you may have the right side of politics see the appeal of this as a war on drugs style thing, that there can be short-term political opportunity there. And from the left side of politics, you've seen this real, I think, quite condescending attitude to medicalise, to pathologise people who vape and use other less harmful nicotine products as sick and in need of medicine. So I think there's a criminalising tendency on the right side of politics, a pathologising tendency on the left side of politics, and the sensible, voices of consumers and harm reduction advocates gets drowned out in the process.
I might just throw to the panel for any final thoughts or perhaps advice for people who are interested in this policy area on things that they can do to help affect change. I'll start with you, Jordan. We'll start down the end and work back.
Yeah, well, I think that, as I say, it's a shame we weren't joined by Brian today, because I was really looking forward to seeing him and hearing from him on this issue. I know that legalised vaping, who Brian is an advocate for, and organisers have been very active with petitions, and I understand that they're going to be putting out sort of a vaping/tobacco how to vote card ahead of the election. That's my understanding. And I do think that, as with other, parts of society who have been impacted by government policy failures, I think it's incumbent on Australians who have typically been quite apathetic or quite frustrated by politics. I think it's fair to say a lot of people who vape may well have historically, at least once or twice in their life, voted informally, potentially, or have a greater percentage of that. I think that using our votes for change and affecting positive change in policy through advocacy and participation in the process is really, really important. And I mean, a stat that I think the report you guys had, the Victorian PBO do, was something like 7% of the adult population of Victoria vape. And I think that's an incredibly powerful statistic. That's a statistic that can, win or lose seats potentially in some electorates, including the Senate race. So I think that's, that's my message. It's really important to recognise the power that stakeholder groups like the adult consumer vape market hold, and that they should be organising and wielding that influence.
I think vapers and smokers, I think Pippa raised it before about how everyone makes this policy about them without including them in the policy. Vapers and smokers should be a lot more angry about the way that they're treated by policymakers than they are. It surprises me that they don't organise protests and stuff like this, because it's absolutely outrageous that they come up with all these crazy policies. They tax the bejesus out of them. They stop them choosing, making better health decisions for themselves and their families. and they don't get consulted on any of it. It's absolutely outrageous. I think that, you know, vapers and smokers need to make their voices heard, because they're getting shafted big time in all of this. They're the ones that are getting taxed through the nose. They're the ones that are sort of, in a way, being forced to engage with organised crime, and it's not good enough.
Yeah, I'd agree with both David and Jordan on that. I think people who use less harmful nicotine products are being treated with contempt by politicians and by a condescending public health sector. Yeah, so I'd agree. I think get angry, but I think also channel that anger into advocacy, as Jordan suggests. Politicians are typically much more accessible than people often realise, particularly if you are a constituent. You know, they've got email addresses. Get in touch. You know, generally, you know, my experience at least, I found politicians to be pretty responsive. The other big one here is the news media as well. So news media have been prime participants, you know, primary drivers of the moral panic here and purveyors of misinformation. So if you read an article, the latest moral panic, vaping more dangerous than smoking, or any of the other nonsense that's out there, write in, you know, complain. Point them to the Cochrane reviews, point them to the Royal College of Physicians that undertake living reviews of the latest scientific evidence, and set the record straight.
I think that's really good advice. And, you know, I got asked this question myself a lot when I was more involved in activism. And the way that I would generally answer it is to show up, whether that means calling into talkback radio, whether that means sending a letter to the editor, coming to an event like this, whatever it is that's within your capacity. If you're passionate about it, then show up and be involved. And that's it's kind of really the only thing that you can do. If you're involved in a political party, whichever one, make noise internally. You know, we're hosted today by David Limbrick from the Libertarian Party, but, you know, maybe there's people watching online that are members of a different party. Well, make noise within that party, like cause a bit of friction, stir them up if they have bad policies on this stuff. Well, I think that pretty much brings us to the conclusion of today's events. So on that note, for the people both in the room and on the live stream, thank you very much for showing up. Thanks to the Parliament of Victoria for hosting us in this lovely building today. Thank you to the Parliament staff for coming here on a Sunday so we could put this event on. Thank you to all of our speakers for generously donating their time. And I'll throw back to David Limbrick and finally thank him for sponsoring this event and allowing us to be here today. Thank you.
I'll just sit down. Look, yeah, thank you everyone who both turned up and those of you watching this online. My objective in all of this has really been that we need to have a discussion about this. We need to continue showing an alternative point of view, because the current trajectory is going to lead to ruin. You know, I'm doing this because I care about people who are affected by this, by smokers, but also I also worry about the explosion of organised crime in Victoria and the associated effects of that. It's a big problem, and I don't think that the current path that both the state and federal government are heading down is going to work, and therefore we need to provide alternative viewpoints on this, and hopefully today we'll be able to do some of that. Thank you.
All right. Awesome. Y'all got that for me?
Thanks, Dave.
Awesome. Thanks a lot.